Yeah, well, I mean that third row. That's the. You got it. First, it's all the pop up
She is. She's a long way from home. Introduce yourself. Okay, we did. Yeah, so you are a long way from home. How nice of you to come this far. It's a beautiful area.
Would you mind terribly if I set my camera here? That'd be okay? Alright. It's just really in the way over there.
That's no problem.
Are you the paper or?
I'm not freelancing.
Oh, cool. Nice.
I was hired to live stream.
What's that?
I was hired to live stream.
Oh, cool. Who are you working for? Oh.
See? I'm the video guy.
Oh, okay. Oh, okay, the organizers.
Yeah.
Oh, cool. Okay.
Okay, folks, so we're going to go ahead and get started. I appreciate your patience for letting us get a little bit of a late start, just kind of making things happen logistically. And so what I want to do first is welcome you for a community forum that was put together in just about a 9-day process. And, we weren't sure how many people in the community were going to be able to come out and be at this event. So I appreciate you from no matter how far away you came, but for coming out tonight to talk about something that I think is very important to all of us. Our healthcare environment is changing. It's changed very dramatically over the last 18 months and is going to continue to do so. And so I think it's important for us to talk about what has changed, what is expected to change, and how it's impacting those of us already, and what does it look like over the next however many years that we're under a COPA. So we had some very gracious guests who agreed to come and speak tonight on different topics. So we have Dr. Marty Olson is here, and he is a physician. He's just going to speak to us about the importance of having a healthcare system who listens and communicates with its patients and its community. We also have Dr. Berry as well. Both of those physicians have written some great op-eds for us in our local papers, and so I think it's incredibly important to hear from them. Dr. Starla Kaiser was unable to be here. She had a previous engagement that was already booked. However, she did send a statement for me to read on her behalf. Dr. Scott Fowler, I did hear from his office today. We did put this together, like I said, last minute, and so he was regretfully unable to attend because he had a prior engagement as well. However, what he did say was that he wished he could be here. He does realize the importance of this issue, and I'm going to read a little bit from his statement at the FTC workshop hearing. He did not want me to just, throw something together last minute when he speaks. He wants it to have impact, so I agree with that as well. So I'm grateful for that communication. We also have Dr. Ken Smith in the building as well. Commissioner Angie Stanley is here. We've got some patient stories that are here. We have one patient who will not be able to be here today. She was in a car accident this morning. So if we could remember her and her daughter in our prayers, they will not be able to attend tonight. But we do have some other folks. And so I'll introduce those people as we go along. Just to get started though, I want to give a little bit of information. I guess most of you guys know me at this point. Some of you like me, some of you might not. People have asked why I am here and why do I continue to do this and why was I willing to move back home? And I feel like I've answered that question a lot. And I feel like I've addressed the rumors where people feel like someone's hired me to do this or paid me to do this. I hope that I have. It's very simple. I want to live a life that matters, a life of contribution. My daughter was born at Holston Valley Medical Center, and my granddaughter was born at Holston Valley Medical Center. When I knew I had a high-risk pregnancy, that's where I wanted to give birth. When my daughter had her pregnancy, we knew that's where we wanted to give birth. And we didn't think it was gonna happen at 26 weeks, and we didn't think Bella was gonna weigh 1 pound and 3 ounces, but it did, and she did. And if you've never had a child in the NICU, it's a completely different experience because you're trusting people to do the things that we mamas and grandmamas are just born and equipped to do. You are trusting somebody to know how they like to sleep and when they want to eat and what does that cry sound like and when they can cry, and you're hoping that one day they're going to be able to cry and all of those different things. And so I became to love and adore the staff that saved my grandbaby's life. And when I heard that the NICU was closing, that alone was enough to get me a little, you poke a mama bear and we growl a little bit, and it wasn't very long after a little bit of research that I found out there was so much else happening. There were laws that were passed. There were, people who were hired and, agreements that were made and all types of things to limit. And this is just the way my simple brain thinks of it, is if you believe with all your heart that what you're doing is in fact for the best interests of people, why do you have to pass laws that keep people from opposing it? If the changes and decisions that you're going to make are in the best interest of the people, why do you have to pass another law that keeps what you're going to do private? Right? It's grown into something more than I ever thought it would be. And I've met phenomenal people along the way. I am super, super grateful to my Rally for the Valley community. And I don't want to call names because, oh my God, I always forget. There's like 50 some like regulars, So it's a lot to keep up with. But just know that I appreciate every single one of you for all of the things that you do, for the people that have slept outside with me, and it's going on 119 nights. You matter. You're amazing. You're incredible. And your hearts are unmatched. And we will not be deterred by people who want to hide behind choice statistics and cherry-picked data and laws and corporations and all of those types of things. We're just not doing that anymore. I believe in the people of this region. I believe in the way that you can come together. You've done it on several occasions. When I've showed you families that were struggling, you all stepped up and made a way for them. School supplies, backpacks, birthday parties, right? Electric bills, all those types of things. So I know the heart of this community, and I believe that you have been sorely underestimated. You have been grossly underestimated. I believe in this community, and I believe that we have the ability to change something that is changeable. The COPA is a living, breathing document. And so what? They got it wrong the first time. Let's show them how to get it right. To open us up, I want to open with, because this is a discussion on the impact of our changing healthcare environment, and with any discussion, you need good communication from all parties involved. So to open us up, I would like to welcome Dr. Marty Olson to the stage, and I'll let him take it away. Thank you, guys.
I'm going to get untethered here, I think. How good to see all these people here. Give yourself a round of applause for caring about healthcare. I'm glad that we care about the healthcare not only for ourselves, but for our neighbors and for our fellow citizens. And my belief is that we need a system that's responsive to the community. We need to find a way that there is a protest mechanism, a way there's accountability. And as we look at that, we need to look at how the board is structured in a concrete, problem-solving sort of fashion. Let's talk about another problem. Let's imagine you go home tonight, you turn on your water spigot, out comes some mud. Well, you're not happy, so what you're going to do is you're going to call the water department, and they're probably going to take good care of you. But they know if you don't, you're going to call an elected official. And let's say that you're not happy, so you call an elected official. Well, the elected official is probably going to want to help you, but she or he knows that if you're not happy, you're going to vote for somebody else. This is called accountability. This is how things work. This is why our water is good in East Tennessee and Southwest Virginia. This is why the roads don't have potholes in them too much. This is why the streets are clean of trash. This is why the lights stay on. That's all called accountability. Now imagine that you're a patient and you're pregnant and you're scared and blood is running down your leg and you're in pain. Well, just like you couldn't say, gee, I think I'll change water companies. You can't say, gee, I'm going to go to Knoxville, I'm going to go to Asheville. You must go to the nearest hospital because you're afraid, you're scared, you're worried about your baby. And if you're upset and you're not happy with your care and you call your elected official, that person says, I don't have anything to do with that. I can't help you, I'm sorry. And that person is not dodging, that person is giving you the truth. And so this is something that we need to change. We need to find a way to have accountability. Now I'd like to tell you a story, and again, in the past I was a mid-level healthcare leader. I am not now. But this story is more than 10 years old, and it's a marker of something that we don't want to see. So it's back more than 10 years ago, Johnson City, Tennessee, the old Mountain States decides they're going to build a new hospital. And they're going to replace some other hospitals, build this new hospital. And for the record, it's a good hospital. It's an award-winning hospital. Dozens of employees, or dozens of doctors, hundreds of employees go there every day to plan to give good care. I'm not saying bad things about any human or any facility. I'm saying we need to change the system. So I'm on this committee. This new hospital is going to get built, and the word is it's a concierge hospital. That's a hospital meant to make money. Money is not bad. We need money to pay bills. So the fact of a concierge hospital itself is not bad, but my personal belief was that maybe there was a better mission. So I'm at this committee meeting, it's the first meeting, and I said, listen, we're going to spend $100 million on this hospital, and I haven't yet heard how the healthcare of our community is going to be better. So kind of give me some information. How's the healthcare going to be better? Well, the facilitators didn't like to hear that. And these are paid facilitators. Theoretically, they're there to make sure everybody's voice gets heard. In reality, they were there to make sure that we went towards a plan, pre-assessed goal. It was okay for me to have said, second floor, third hallway, fourth door on the right, let's move the doorknob the other side. That'd have been fine. Mission and vision, it's already decided by a small group of people. So, I'm ignored. I got a thick skin. It's no big deal. A couple weeks later, we got another meeting. But in that time, an event had occurred. A woman had a baby at the hospital, not Johnson City Medical Center, and the NICU was, quote, full, which meant that her baby had to go to Knoxville. So she's in Johnson City. There's a NICU 2 miles away. Her baby's in Knoxville. She's separated from her baby. And that's just because of the system that we have, that if your baby is not born in that same hospital, it doesn't matter if it's Bluefield, West Virginia, or Johnson City, away you go somewhere else if the NICU is, quote, full. So I explained this to the group and I said, listen, we need to create a system where this doesn't happen. How about we have a vision for a hospital? Let's put all the labor and delivery units together. Let's have the finest women's health care between Vanderbilt and the East Coast. Wouldn't that be a good vision?
Yes.
Well, it turns out that the facilitators, it's hard to stand up here and turn your back on people. That's not easy, but they found a way to do it. It was very, very clear that my comments were not welcome. But again, thick skin, no problem. But there was a part 2 of that, because a couple days later I'm in my boss's office. And remember, I did not work for Mountain States. I worked for a separate institution. So I'm in my boss's office and the boss says, Marty, I am sick and tired of having to clean up from your big mouth. Stop it now. You will not make Mountain States administrators mad. So here's why we're having this story. Now, I don't know what goes on now because I'm just out seeing patients now. So maybe this has never happened again. But it did happen, and there is no system in place to keep it from happening again. We need a system to ensure that people can say what they feel without receiving retaliation. We need a system where people can come together, bring their ideas together, and create a plan that's good for everybody. Create a plan that makes patients happy. Create a plan that improves the health care of the region. So I'm an advocate that we need to find a system where the board of directors is answerable to elected officials and the public at large. And I think that's a change we can make. And as we think about what I learned from the past, in the past it was the entire healthcare system making 2 or 3 people happy. That was the goal. Versus the entire healthcare system working to make healthcare for the region better. I mean, why don't we have a goal where we have the finest rural healthcare in America? That's a reasonable goal. Why shouldn't we have that goal? Why shouldn't we find a way that hospital administrators, elected officials, patients, doctors, nurses, employees can all get together? So I think our challenge is, let's find a way to make the board accountable and have the finest rural healthcare in America. Thank you.
Thank you, Dr. Olson. You are much appreciated. I had the opportunity to sit on a panel for a Greenville town hall back in April with Dr. Olson and Dr. Berry as well. So I'm grateful that they were able to come this way and bless us with their expertise and their knowledge as well. Before I bring up our next speaker, I'm going to go ahead and read the statement that was sent to me by Dr. Starla Kaiser. As you all know, and if you don't know, she wrote an incredible opinion piece for the Bristol Herald Courier. And her opinion piece was phenomenal. I think what happened in response to that was astounding. In response to her editorial piece, Anthony Keck of Ballot Health sent her a 10-page letter in response. Now, what you may not know is that Dr. Starla Kaiser is also running for Virginia delegate. And not only did they send a 10-page letter to her asking her to retract her opinion piece, they copied her political opponent on that 10-page letter as well. I think that that is another demonstration of something that is problematic within our healthcare system. Our healthcare system in particular just has a whole lot of politics involved. And I think when you add politics and healthcare, you somehow miss the care that's supposed to be in healthcare. So anyway, she sent this statement because she had a pre-scheduled engagement this evening. So this is what she said. She said, "Sorry I cannot attend this evening's forum. I will be following along though. My statement is below." And so it says, "When I moved back home to Southwest Virginia in 2017, I started a clinic to help those without insurance before Medicaid expanded in Virginia. At times, I would need to refer my patients to Ballad for imaging studies, emergency room, or specialist visits. I have been with these patients, friends, and family members as they have navigated the system since the merger, and I have come to believe that this healthcare system has been strategically designed to put profits over people. I have been concerned about our healthcare costs. I have seen patients being funneled to hospitals for care that could be performed in outpatient facilities. I have seen suspect billing practices. I have seen low-income patients' bills increasingly sent to collections and many of them sued. This is profits over people. I have been concerned about our health outcomes and have seen the effects of consolidation. As smaller hospitals are downgraded and programs are moved to larger hospitals, I have seen patients show up at local hospitals expecting definitive care for basic issues, and instead they pay for delays in care and expensive transfers to large hospitals. Again, profits over people. I have seen staff leaving our hospitals in large numbers as they look for better paying and more secure jobs elsewhere. This has resulted in diversions and delays in care at all our hospitals, even at those large hospitals that are supposed to accept all the admissions and become centers of excellence. Despite the company line, the staff shortages are not a reflection of national shortages. It's profits over people. These changes have created a less accessible, higher cost, and lower quality health system in Southwest Virginia and Northeast Tennessee. And as our healthcare suffers, so our economy suffers. As doctors leave the region and hospitals are downgraded, less tax revenues are collected and less money goes into our local economy. Families decide to live elsewhere to access better healthcare. Companies decide to locate to regions without healthcare monopolies. This is the reality, and this reality must change. Ballad Health, like many other corporations in this part of the country, was counting on us doing nothing. Yet, we cannot just accept that this is the way healthcare will be from now on. We must do something, and the time to act is now. The time of companies taking advantage of us is over. I have been inspired by all of you who have taken the lead, those of you who have had the courage, the perseverance, the faith, and the audacity to believe that we deserve better healthcare and to speak out and demand changes. You have made it easier for all of us to take a stand. To all the patients in Southwest Virginia and Northeast Tennessee, I will do everything in my power to fight for the care we all deserve. But we must all work together. We must hold this health system accountable and, at a minimum, improve oversight of this monopoly. I am certain that our collective action will make a difference, and we will see a better future in Southwest Virginia and Northeast Tennessee. Thank you. Those are the words of Dr. Starla Kaiser, who I'm extremely grateful for. So next, I'm going to bring up Dr. Robert Berry, who has written several pieces in response to our changing healthcare environment. One was even in the Tennessean in response to another op-ed that was done by several chief of staff that belong to Ballad Health. So at this time, I'm going to bring up Dr. Robert Berry. Thank you.
I'm coming at it from a different point of view than Marty, but still, we're just trying to keep people accountable. So, and I also have prepared remarks. We have all gathered here at this forum to try to bring some measure of accountability to Ballad Health. Since the formal mechanism set in place, an annual meeting of the Advisory Council had little effect. I am bringing you the perspective of a non-Ballad, insurance-free primary care physician from Greenville. Non-Ballad because I'm not an employee and have no contractual arrangement with Ballad, even though on the Google site I am listed as a Ballot Associate at the very top. Imagine that. So my patients therefore feel free to give me their unfiltered criticisms of Ballot. Insurance free because we've never signed any insurance contracts. The first 18 years we were fee for service and transitioned this year to a membership or direct primary care practice called Direct MD Greenville. The major unfiltered criticism I hear from patients is that they, a family member or friend, has been sent to collections even before they receive their bills from Ballot. Anybody had that before? Almost all of my patients are self-employed or own or work for a small business. They are farmers, general contractors, plumbers, excavators, restaurant owners, and they don't have time for that sort of nonsense and don't appreciate having their credit threatened. They don't treat their customers that way and don't expect to be treated that way by anyone. That's why many of them are telling me when I need to refer them anywhere but Ballot. Ballot might have a monopoly of almost all medical services within their service area, but not outside of it. And many of my patients are choosing not to use Ballot, even though its specialists can take care of most of the referrals I make. If our region becomes notorious for bad health care, what talented people or companies will move here in the future? How will we keep our talented young people from moving away? In the future, the economy here could become more depressed and our property values decline if Ballot continues its current course. Many of my patients show up at Ballard's Greenville ER and need admission to the hospital are transferred to one of its 3 major hospitals due to a shortage of nurses to staff its beds. Patients transferred from the Greenville ER then incur an ambulance charge. To avoid this charge, patients are increasingly traveling to the Johnson City Medical Center ER, but then are finding that to no one's surprise. It is overly crowded and takes too long to be seen. My patients believe that the Ballot administrative leadership cuts staff and services to enrich themselves at our expense. They can dispel this notion simply by posting the total compensation packages of their administrators on its website. After all, taxpayers give it the high honor of not having to pay tax on purchases, property, or net income. It can return the favor by being transparent about its administrators' compensation. Don't you think that? Then there's a matter of cost. Since my practice serves mainly the uninsured and people with high deductibles, my patients have no choice but to pay out of their own pockets. Many of you in this audience, I suspect, are choosing high deductible policies just to be able to afford your monthly health insurance premiums and find yourself in this situation as well. Direct paying patients have told me they have been billed around $2,000 to have a laceration sutured at Ballard's ER, when it costs them about 1/10 that at my practice. A visit to a Ballard ER for a kidney stone runs $4,000 to $5,000 if a CT scan is done. We treat the pain and nausea of a kidney stone in our practice for the cost of the medicines during office hours, about $10, and $150 if it's on the weekend. We have obtained same-day CT scans at Outpatient Diagnostics in Knoxville for $320 if the diagnosis of a kidney stone is in question. Of course, it is not practical for patients to shop for medical care while they are bleeding from an open wound or suffering from a kidney stone. At my practice, and at most direct primary care practices, a doctor will come in after hours to take care of such urgent conditions. We do our best to keep patients out of the ER and at a reasonable cost. But most medical problems aren't so urgent. They are what President Trump's executive order on pricing and quality transparency calls shoppable. When our practice was fee-for-service, you could have shopped for a visit at our clinic. Our website and a sign in front of our building proclaims $60 for a visit for bronchitis or poison ivy, $75 for management of hypertension, and $125 to repair a simple laceration. We have always been upfront and open about pricing. You can now find our membership rates on our website or in one of our brochures, which includes no charge for office visits during office hours, along with labs and medicines at virtually my cost, so that a complete blood count and a generic Zithromax pack costs only $5. This is typical of direct primary care practices, which are popping up all over the country in response to the impersonal and expensive care of health systems like Ballard. These practices rightly could be described as the opposite of Ballard or unballot. But what about services such as MRIs, colonoscopies, and elective surgeries, you might ask. These too are shoppable. Our patients can obtain an MRI of the knee for $422, including the radiologist reading at the Newport Hospital through a national program called MD Save. Ballad lists it for $7,000. On its Chargemaster list located on a spreadsheet on its Woodridge website. I don't think it has joined the MD Save program yet. A colonoscopy can be obtained for $1,275, including anesthesia through Colonoscopy Assist, but patients have to travel to Greenville, South Carolina for it. The total price at Tri-Cities Gastroenterology runs around $1,500, and so I give my uninsured and high-deductible patients that choice. I challenge you to find such an all-inclusive price for this common and routine procedure on the Ballad website. Yeah. A patient of mine needed a nasal polypectomy and traveled all the way to the Surgery Center of Oklahoma, where total prices for over 250 procedures are posted on its website, which include the fees for the surgeon, anesthesiologist, and facility. He saved more than $10,000 over what was quoted to him locally. This was before the Ballad merger. To Ballad's credit, it met the Oklahoma price for a patient who needed the same procedure just a few months ago, when the patient printed the price from the Oklahoma website and took it to them. So you can do that too. A few of my patients have gone to a similar facility in Charlottesville, Virginia, called the Monticello Community Surgery Center. A person can obtain a hernia repair for $2,000 total at Affordable Hernia Surgery in Rockville, Maryland. You see, physicians and medical facilities can be open and upfront about their prices. Why can't Ballad? It probably would say because pricing is complex. They have different contracts with Medicare, TennCare, private insurance, which what they have to contend. I think Ballad is making it more complicated than it really is. We need a facility like the ones in Oklahoma and Virginia to open in Tennessee, preferably in the Tri-Cities, to serve as an alternative to Ballad. But that is not likely to happen because it would require a certificate of need or CON. You see, Tennessee is one of about 30 states that still have a CON law. Georgia eliminated its CON this past spring. A bill to do just that passed a House committee and sits now before a Senate committee on which Senator Rusty Crowe is a member. Senator Crowe, of course, is from the 3rd District and has financial ties to Ballad, the details of which he successfully hid from public view with the passage of his Senate Bill 2048 into law during the 2017-18 legislative session. If you want an alternative to Ballad Health to keep it accountable, we all need to pressure Mr. Crowe into passing this bill. If he doesn't, then voters in his district can keep him accountable by not re-electing him. If Ballad Health is the result of forcing a single supplier of health care into a small region of the country, just imagine how unaccountable health care will be if there's ever a single national payer. The leadership at Ballad has said that the hospitals around here would have to shut down if it weren't for its merger. I'm not sure I believe everything Ballad says. In a press release of the Greenville Sun on August 19, Alan Levine said that there have been, open quote, 0 infections for abdominal hysterectomy cases across the system, which would be commendable if it were true. One of my patients underwent a hysterectomy last fall, suffered many complications, including sepsis, and nearly died, and is scheduled to have her colostomy taken down in early October in Knoxville. I say this not to criticize her doctors because, knock on wood, complications, even death, occur in any medical or surgical practice. Thankfully, this patient is alive, and I only mention this with her permission to show that Ballad's self-reported information might not always be trustworthy, and we should acknowledge that going forward. I don't claim to know how to keep Ballad accountable, but eliminating the CON and allowing competition is one part of the puzzle, I believe. The other might be to replace the current appointed Ballad Health Board of Directors with one elected by the community.
Okay, so how are you guys feeling so far? I'm a little bit of a pulse checker girl. If y'all don't know, before all this, I was a poet and all kind of stuff, so I like a little bit of interaction with the audience. So how are you guys feeling about the information, just from the little bit that you've heard so far? I think what's important to note is that these are experts. These are physicians. These are folks who know healthcare and they know it well. And a lot of times what you hear is Ballot Health saying, well, they don't understand for simple folks like us to understand complex healthcare issues. Country, not stupid. And it's great to have experts in the room and in the building who can speak knowledgeably about what they've seen and what they see from their outside door. I think one of the things that has been interesting as I've talked to different healthcare professionals over the last 9.5 months is the number of them who disagree with what's happening, are concerned about what's happening, and yet don't feel like they have the freedom to speak out. We've talked about a lot, sometimes with our nurses. We forget providers often feel that way as well. You're talking about folks with student loans and, practice expenses and all of those types of things. And, it's a sad conundrum that we're in when you have to choose between your passion and your purpose in life, which is caring and healing people, and then being able to provide for your own families. And unfortunately, that's the way that many people have expressed that they feel. So I applaud the physicians who are in a position to be able to express themselves and to speak about what's happening in our healthcare environment, for giving a voice to those who feel like they cannot. So again, I appreciate you guys for doing this. So before I go any further, I'm going to read from Dr. Scott Fowler. So if you all don't know, there were about 15 of us who traveled up to Washington, D.C. in February to the FTC Health Check on COPAs. It was a workshop where they were looking at the COPAs that had been granted previously, how did they end, what happened with them, and what about the COPAs that were happening right now. And in doing so, Dr. Fowler went and spoke, and I have to tell you, I was holding my breath at first because I wasn't sure what he was going to say. I was like, oh dear, come on, let it be something helpful, And by the time he was done, I was in tears. I was just so grateful to hear someone speaking truth to the issue, and someone with such a powerful voice. So this is part of his FTC testimony. What I will tell you is that this information in its entirety is located on the HMG website. It is also located on the FTC's Health Check on COPAs site. The video is there as well as the entire transcript. So, I encourage you to go read it in its entirety. It is a little lengthy, so I don't want to take up a lot of time reading everything because some of it is the history of HMG. And so I want you to get the full scope and the full picture of what he had to say. So one of the things that he is talking about, let me get here. So I want to pick up at, it's kind of an awkward place for me to start, but in the transcript of session 2, I'm starting on page 13 of 48, and I'm starting at the second paragraph down. And the reason why I am, let me just start at the top. I'm going to start at page 13 of 48. And it says, the hospital-centered governance financial operational system proposed in the COPA were weak. The impact of a monolithic monopoly, which in this region, it is the biggest employer, as you heard. It has tentacles in everything that happens in our community. It will impact the local economy. It will impact outpatient markets. It will impact the geographic distribution of services, not necessarily based on where patients need them, but based on what's economically efficient for the systems. Maybe we don't need 2 trauma centers, but maybe we need the trauma center in Kingsport. Maybe we don't need 2. Maybe we don't need 2 children's hospitals, but maybe where the children's hospital is, it needs to be looked at more carefully and not just on financial grounds. At any rate, price transparency transparency and parity, as you heard today, in the outpatient marketplace has to be part of the metrics of success. The ability to block or to squat on value, and I get the whole idea that value is something that we need to coordinate. We need to be interoperative and interactive with, and I applaud all the efforts. And I think they can be successful to bring people together to do value. But we know that historically, the financial interests of a company drive its behavior. And it's in the financial interest of these hospitals to drive service lines and work into the hospital where the prices are higher, and to use the hub and spoke models that have traditionally been used. CMS, which is the Centers for Medicare and Medicaid, in its final rule this year on Medicare shared savings programs, specifically noted that hospitals were forming ACOs, accountable care committees. You may have heard about those, accountable care organizations. ACOs that were actually blocking the access for patients to get into ACOs that were doing value. Because by building those ACOs, those patients would not be attributed to another model. We were skeptical, to say the least, and did not think the application would meet the standard. As an attorney, I went to law school before I went to medical school, but as an attorney, the clear and convincing standard seemed overwhelming to me, and we just didn't think that it would happen. So what's happened since the COPA? Impacting patient care, rushing changes, having things happen too quick. Of all the models I saw up here today, the one at Phoebe Putney reminded me of what I'm seeing on the ground, which is a lot of confusion in an effort to coordinate between a business and the government. Rapid changes on the ground which impact patients. So let me give you just a couple of examples. Shortly after the COPA, we had about 10 outpatient surgical rooms that were operating in town. Those were places that you could take your patients as an alternative to surgery in the hospital. Shortly after the COPA, all of the beds were closed. This center that we were owners in was dissolved against our objections. And when we offered to buy the center so that we could continue the care, that was refused. As a result of that, Bristol went without an open surgery center for quite a few months. Now, eventually, will that get fixed? Yes. Did it need to happen? No, it didn't need to happen. It created bad care and bad experiences, and it was dissolved where there was another opportunity. So we think that it was probably done in order to help them control the outpatient marketplaces. We have a lot of information that that may be part of what was done. In Kingsport, the same model will limit rooms, will allow the closure of one of the surgery centers there, and will bring other players into the marketplace, possibly with higher priced national contracts. CON law, Certificate of Need law, adjustments in the COPA will eventually, hopefully, fix this. We were able to go and get a CON. The hospital was not allowed to object to the CON, which was in keeping with the COPA. And I applaud the fact that we were able to get that CON, but it won't be open for a year. So between now and then, it won't be. In the meantime, the outpatient ambulatory surgery center that is there is being restructured to put restrictive covenants on the doctors that are owners there, so that if they leave, they can't be owners in other centers. This type of behavior is perhaps predictable, but it is not the kind of behavior you expect from people who are trying to do the right thing. The connection to the HIE in Knoxville, the plan to build a separate HIE, and the HIE in Knoxville won't connect to our HIE. The threatened and confirmed, I guess, loss of the NICU and the trauma center in Kingsport, bad for patients. It's bad for the geographic region. It will affect the economies in Kingsport. There was a lot of discussion about whether it would have been much better to just sell to an outside system. There's widespread confusion, and it could have all been avoided. In summary, let me just say, I think our skepticism has perhaps turned to some opposition, but I want to be careful to say that it's in specific areas. I do think the COPA has the potential benefit to the community if it can be regulated and monitored, just like we said in our original. And although what I've heard today makes me even more concerned that it's a bad idea, I do think that there are certain areas. I think we have to recognize that it maintains and empowers an old paradigm. and that's a hospital-centric model of care. Perhaps it's the most common paradigm in America, but it's not the future paradigm, and it's probably going the wrong direction in maintaining the status quo. There's no question it will interfere, block, or perhaps subsidize and inhibit other efforts that have been made in the region, because it will become the dominant place where people look for change. And there's a lot of other players in the marketplace that can bring change besides the hospitals. I believe that it will fragment between hospital-based and non-hospital-based providers. It creates an economy of scale, which can change really real estate. We know our leases are changing. Immediately after the COFA, the hospital is moving things into buildings that it owns rather than leasing from other places. So there's a lot of financial need to make this money to reinvest, I suppose, that they do the things they plan to do, which is create economies of scale. At this point, it appears that the risks outweigh the benefits of the COFA, and we'll have to see if some of these things can be addressed. So those are my comments. Those comments are not mine. Those comments are Dr. Scott Fowler's comments. Thank you. To piggyback on some of those comments that Dr. Fowler talked about, you heard him talk a little bit about surgery centers and potential people coming in with those contracts at higher pricing rates. That is something that we do know is happening, right? We do know that USPI has a national payer rate compared to what we had here locally. So these are concerns that are real, that are tangible, very much in your face. We know that Allendale, is no longer our cancer treatment or infusion center, and it's moved onto the Indian Path campus. We know that with that move came facility fees in the amount of $241 per visit. We know that the sleep center is now at the bottom of Wilcox Hall, and it's a $70 facility fee for it as well. So when I heard Dr. Fowler say these things at the FTC workshop, those things came to mind. And I thought, that's exactly it. There are things that should be being done or could be being done outpatient, and in fact were being done outpatient or off hospital grounds that are now being moved to hospital locations in order to be able to charge more money for them and have these facility fees. Does it get the hospital 340B pricing? Yes, it does. Does that get them a discount on their drugs? Yes, it does. Are those discounts being passed on to you as patients? I didn't even have to answer that one for you. See how that works? Again, we're country, not stupid. Okay, so I want to I'm going to bring up our last physician before I bring up some other folks and let him kind of round out the evening. This is a neurologist, a neurosurgeon. Let me get it right. Look, he flinched as soon as I said it. But it's Dr. Ken Smith. So you guys welcome him.
I was just trying to think exactly what to say and how to end this up, but there's a reporter here from Modern Healthcare, and she said, this thing is sort of hard to digest. I can't figure out what's going on. Ballot says one thing, I say another. So, yes, it is very strange when you wake up in the morning and what someone says doesn't map out onto the reality that you lived the day before. Okay, is this better? Yeah. Okay, so it's very strange when you get up in the morning and the reality that you were told by someone doesn't map out exactly onto what you lived the day before. Yes, the nurses are leaving, and they're leaving because they're treated poorly. They're not leaving because it's part of a national problem. They're going short distances away to places who treat them better. Did they get a pay raise? Yes, if you were a young nurse. The older ones, there were so much respect, they get 20 cents on the hour pay raise, and then they restructured their vacation or schedules, and also they all wound up with less money in their pocket. So when you begin to see these things, in this way, you realize that what is being said is not what's actually happening. You guys know this. The article that was written by the 3 chiefs of staff, that was not written by their hand. So, many things are under the surface here that are going on. But the main thing that I wanted to discuss with you is this, that when October 1st comes by, you will have lost 50% or more of your level 1 board certified trauma surgeons. So where do people go and how did they decide to do this? The idea was we will redefine the level at which you deserve trauma care. So instead of the rest of Tennessee, which you have to be injured to a certain rate, they upped that. So you had to be much more severely injured. How do they make sure you don't go? They just took it away. So where are you going to go if you have an injury that we can't take care of at a level 3? You're going to get on a helicopter? Are you going to go to Knoxville? It's going to be full. You're going to go to Roanoke? And what's going to happen? That is my concern, that in all this, we've argued about where the trauma center ought to be, but nobody has said who gets to decide how much care we get. And my position is that we decide how much care we get. And we decide that through competition. And if you can't give us enough care, we go somewhere else. But the federal government, the state government, and ballot has created a gulag here. If you can't get out because of the severity of your injury or your financial condition, you're stuck here. So my concern is with those people. That is the piece that most directly affects the physicians. It's a moral question. What do you do when someone comes into your hospital and you don't have enough resources, but you know they can't go somewhere else? And these are the things that are very immediately coming upon us. And the other speakers hit on exactly the lack of planning, the inability of the system to move in a positive direction. So I want people to take away this, that something very valuable has been taken away from us. And it is hard to quantify, but it's easy to see. And you will see it up close and personal October 1st. Thank you.
Okay, so I'm going to give you, appreciate you, Dr. Smith, again. So I'm going to kind of give you what we're going to do next. So I've got, we've listened to some physicians. You guys want to hear from somebody with some extensive nurse experience? We're going to do that next. Then we're going to do EMS, and then we're going to go straight into some patient stories. And then we're going to have a panel. And here's what we want to talk about is potential solutions. What are some things that we can do when we leave this building that will make a difference? How do we get a handle on our health care? So we're gonna have that conversation as well. So, and I almost left you out, but I'm not going to. Okay, so it took me like 2 seconds, then I was like, no, because I really want you to hear from this person. Okay, so next, I'm gonna bring up an incredible individual with an extensive amount of nursing background, and not to waste any more time, I'm gonna introduce the incredible, very well-versed Kelty Kearney.
That's assuming I can get up the steps. I fell on a trip in Austria 2 years ago and broke my ankle on the first day of a 16-day trip. So healthcare is very important to me now more than ever. But I don't know how much I can add to what's already been said. I can echo much of what I have heard. I can share from nursing experience my 25 years at Holston Valley Wellmont. And then I'm not really proud to say that I did work at the other place for a little while, but it was a great place in Norton Community, and then it became Mountain States. So there was a culture shock and a culture difference when Mountain States took over there, and then we now see Ballad. So what we're seeing today is change, 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 and if you haven't seen it, you've heard it. Every single day, and I'm not exaggerating, I hear a horror story about an experience of someone or their loved one in a facility. And sadly, it's the one that's more proximal to my heart that has been, so much has been taken away. And as Dr. Smith says, come October the 1st, what's going to happen? The real effect will happen. But I can recite story after story, and I can share with you personal experiences. Most recently, what happened, a 6-hour-and-a-half wait with a grandson who was having a hystemic reaction to an insect bite, who was seen in the community by an experienced emergency room physician who said, you need to get this child to the ER immediately, and proceeded to share with us what we needed, which we knew when we got to the ER. The physician would be in charge of that, but we had an idea of what we would be needing. We went to one hospital because the trauma facility was on diversion. So this was last Friday night. We go to Indian Path and wait 2.5 hours, and we were never triaged. Never triaged. Listen to that. We had a waiting room with a lady who was exhibiting signs of a stroke, as confirmed by the clerk in the ER, who says, now listen carefully. He said, there's a lady over here who's been waiting 45 minutes with signs of a stroke. She hasn't been triaged yet. And we say, my daughter flippantly and inappropriately says, so if she falls over in the floor, do we call 911? And the clerk says, that wouldn't be a bad idea. Folks, this happened last Friday night. It gets worse. I can't make this stuff up. It gets worse. As an experienced nurse, I'm watching all of what's happening in there. A lady comes in who is imminently having a miscarriage. Imminently. And there is no immediate attention to this situation. She finally is taken back, and we have the debris in the waiting room, to which we say, could someone come help clean this up? That was another story in itself. 2.5 hours after a wait, I'm calling Holston Valley's ER. What's your wait now? I know you're on diversion. We're not on diversion. Really? We've been told you're on diversion. So we go to Holston Valley, and folks, we receive the trauma level 1 services that we've known about and deserve and should have in this community. It should not be taken away. They were fabulous. They did everything. They met us at the door, walked us into triage and on back. We got the care that we needed. Exceptional quality care. Now, after this situation is over, however, we make reference to this other situation, and a doctor says the norm will be a 6 to 7 hour wait. Get used to it. That's the way life's going to be after October the 1st. Think about that. A stroke, a miscarriage, a systemic reaction, whatever it could be. It could be you, me, your grandchildren. It could be any of us. We don't need to accept this. So, what are we going to do? I mean, I can tell you story after story. It just goes on and on. But Holston Valley was wonderful. I know you're not hearing that story, you're not hearing that regularly, but they were exceptional. What I've shared with you, I have shared with the executives at Ballot. We were on the phone with them immediately. To their credit, we did get a face-to-face meeting, talked with them. They listened, they acknowledged, accepted responsibility, didn't change what happened, but they did listen. And here's where we all need to, Ballot's listening to our story. You need to tell your story. Everyone needs to be telling their story to Ballot every day, every hour, whatever it is. Let them hear it. Because as one of our former mayors in this town said, I haven't been hearing those stories. Only from a few people. Well, he wasn't listening, and that's probably why he's not the mayor anymore. But tell your story. They say they're listening. Please, please don't be quiet. Share your stories. To add to a few other quotes from our visit, one of the persons that we experienced along the way recently said, "Nobody wants to work here anymore. No one wants to work here. They don't treat us well." And at the conclusion of the meeting with the Ballad executives, after my grandson was treated, we met a young ER nurse, experienced too. She's young. Anyone younger than me is young, but she's experienced 10, 15 years in the ER. And we were passing in the hallway, and she said, "Oh, by the way," to these executives, "I'm done with Ballad. They don't listen. They don't care about us." You're bringing travelers in. You've heard about the travelers, 50 to 60 more influx. From a nursing perspective, that creates a concern. They're not community focused. They're traveling through. They're incentivized, compensated well. So they're here for a short time. That's not to discredit their quality of care that they are competent and able to give, but they're here for a reason. They've been incentivized financially to come here and work for a short period of time alongside a heavily overworked staff that's left. So no one wants to work here, and I'm quoting from recent interaction with staff. How are we going to recruit physicians, specialists to come to this area? Think about these questions. How, when you need this care. I also was in a meeting about 3 weeks ago in Southwest Virginia where Dr. Eric Bowden, some of you were in that meeting, I believe, where he met with some concerned citizens in Southwest Virginia. And I'm quoting him. He's with Virginia Health Department. He said, "Ballad is a business. We can't tell them how to run their business any more than we can tell Walmart how to run their business." Translate that into everyday country language. It's about the almighty dollar. That's what this boils down to. Ballad stands for almighty dollar. So we may not be able to tell them how to run their business, but we can certainly, and I think Dr. Berry alluded to this, we need a group on community individuals who are voted for and brought into. And if we're going to be treated like Nashville and Chattanooga for some things that are taken away from us, well, they do have a community hospital board or a hospital, there's another word for it, I'm sure. Yes, the authority. So we should have that has more accountability, more responsibility, more loyalty to the healthcare services. Another quote from that meeting in Southwest Virginia from one of our politicians, he was asked, "Did you vote for this when the Southwest Virginia Hospital Authority came to their vote?" And he said, yes, but they didn't tell us what they were going to take away. They didn't tell us they were going to close the NICU. They didn't tell us they were going to downgrade the trauma services. Well, did you ask? And one of my EMS colleagues asked that. Did you ask? Well, they lied to us. They lied to us about the financials for Jonesville. They really weren't that bad. And I'm quoting this politician now. They really weren't that bad. So back to one of the former comments from the speaker, I'm not sure that I believe everything that's printed in the paper. It is printed the way they want it to sound. And you can manipulate and stratify and change to meet your needs. So this politician, we can vote, folks. The politician made excuses. He said, "We weren't told they were going to do this. You didn't ask the questions, apparently. You didn't do your due diligence." So When it comes time to vote, think about those things. Something as simple as an MRI. Recently, my husband had an order for an MRI. We were scheduled to go to a Holston Valley facility and got the call 2-3 hours before that the motherboard was down. And I'm not sure what the motherboard is, but it's important, I'm sure. We were given the option to go to Greenville or Johnson City for the MRI. We were not given the option to go to Norton or Bristol. Think about that. We live in Southwest Virginia. Norton would be as close, actually it's closer than Greenville. Think about that. A simple, and I say simple, I know the complexity of that, but when it requires going to Greenville to have an MRI, when accessibility for basic services, it's just no common sense to some of these things. So, I would say, please do. And another quote from another physician well respected in this community, he said, "I have told my family, if I have a true emergency, take me to the closest facility and then the next day get me to Knoxville." Think about that. If our own physicians have that perspective, what are we to expect when it comes time for our care? We need affordable, accessible, timely, quality health care that we can rely upon, that we've come to enjoy and expect, and should not expect any less. I would encourage you all to go, when you can, to the website and look at a little town called Haleyville, Alabama. It's a very small town, about 5,000 people or less. They were told, let's say, September the 1st of 2016, that in 60 days their hospital was going to close. That's it. Birmingham would be south of Haleyville, so Birmingham, a couple of hours away, and they were looking at their options. This community decided we can instead of we cannot. They came together, everyone, the board, the employees, the leadership, the community, everyone came together to save that hospital. There's a difference in what we have now. We hear we can't because financials. We can't. And the politician in this meeting in Southwest Virginia also said another reason he voted for the merger, monopoly, takeover, whatever you want to call it. It is a monopoly. Dr. Bowden even acknowledged it was a monopoly. Whatever you want to call it, the bottom line is the same. We have lost so much, but it can change. If we have that perspective, we can. And it's going to take from the top down, and I'm not shy about the leadership change that's necessary to get that philosophy of we can instead of we can't. So in conclusion, I would say I would encourage you to keep speaking up, keep doing what we're doing to let our voices be heard, because we need health care. It's not like, we have to have a car. We think we do. We could ride a bus, but we have to have quality, accessible, affordable health care. And I want to give Valley credit for something they did do recently, and I'm being sarcastic when I say this. When they had their golf tournament recently, that world's longest drive, it was perfect to draw attention to the world's longest drive to go right by a trauma center on your way to Johnson City. You may get to fly on the Valley wings if you're lucky in their perspective. So thank you all very much.
Thank you, Kelty. I appreciate you very much. I want to piggyback, before I bring up the next person, on a few things that Kelty mentioned. She mentioned Eric, but she mentioned he's with the Virginia Department of Health. What's important for you to know is that he is the COPA oversight person for the Department of Health. So for him to say Ballot is a business and we can't tell them what to do with their business any more than we can tell Walmart is just astonishing, because that's your role as the COPA compliance oversight person, is to tell them what to do with their business. This is the thing thing that I have said repeatedly that I think we need to remember. Ballot is not Walmart. They exist solely at the pleasure of the state of Tennessee and the Commonwealth of Virginia because legally they were not allowed to be created. Right? You cannot have a monopoly in this country. It's not okay to do so. And in order to do that, they agreed to abide by some rules and some standards. And they agreed that if those rules and standards weren't being met, then that COPA could be modified. It could be changed. It could, in fact, be terminated. And those are things that are real. Now, it might make Tennessee and Virginia uncomfortable. They might have to actually do a little bit more work than pushing some papers and asking for reports, but it is absolutely doable. So when Kelty says we need to do something and come together, that's what I'm talking about. I'm talking about making people do more than sit behind a desk and send out a standard templated email response to everybody because you're tired of hearing from us, or better yet, come up with a complaint form because you don't want us bombarding your email account anymore. Like, those are the things that really just, like, that kind of irritated me a bit, can you tell? Sorry. And unlike Kelty, I do believe in calling names. So we can talk about that politician that was in that meeting, Mr. Terry Kilgore, because I have heard from several people in attendance at that meeting. One of the other things I'm really tired of are these politicians passing the buck. Oh, well, we didn't know any better. They didn't tell us what they were going to do. The first time I met former Kingsport Mayor John Clark was when I came here in November and I spoke at the Kingsport BMA. And at the end of it, I said, did you read any of the FTC testimony? And you know what he told me? He pointed to the Board of Mayor and Alderman seats behind him, and he said, I have a real job. This is not my job. Being mayor is not his job. And that's why they have people that sit on boards to tell them about those things and tell them what to vote on and what to support. I am tired of politicians who say, oh, I don't really know any better. Do you know what Senator Rusty Crowe's office told me when I called them in November and asked why he sponsored this legislation? They told me, well, he carried the bill for ballot after they brought it to him because they're his constituents. And I said, well, what about the general public? Are they not his constituents as well? We have a politician problem in Southwest Virginia and Tennessee. And it's bleeding into our health care. So that is why you saw voter registration forms out front on the table for you. I know you're probably going to do it online, but take one anyway as a reminder. Even if you've registered, if it's not updated, if you're not in the right precinct, if you're not in the right places, make sure all of that is up to date because there are a few elections coming up and a few seats that are going to be available. And I know some folks who don't deserve to sit in them any longer, right? For my Tennessee folks, I don't know about you, but I have a serious issue with a contracted employee of Ballot Health who is a senator being the chair of the Health and Welfare Committee hand-carrying legislation for them. That's a problem for me. And I don't think simply filling out a disclosure that says, hey, I'm doing this really questionable, conflicting thing right here should be enough to say, oh, that's okay. Go ahead and do that then, as long as you tell us you're doing it. If all of us, how many of you in here are parents? So if your kid was like, hey mom, so here's what I'm gonna do. Like, I'm gonna skip school today, I'm gonna come on home, I'm gonna roll me up a doobie and crack open a cold one. Would you be like, as long as you told me, it's okay. Like, how does this work in our government that is okay? Things that we wouldn't allow in our own homes. It's not okay anymore. And I believe we are at a critical place in our country and in our community, and especially in our region. There are multiple protests happening in Appalachia right now. Multiple protests. People are blocking train tracks because they're not being paid, right? We are protesting our health care as we speak. Why is that? Because big corporations come into little bitty places like this, where people are trusting, where people have faith, where people are good, and they just believe that you are until you prove them different, and they take advantage of us. And they grease the politicians' hand in order to do it. All right, did I cover it all? Kelty's talking and I'm back there going, oh, not one final thing. I do want to talk about financials. One of the reasons said politician voted for this thing was because of the financials. Let's talk finances for a second, for just a brief moment, okay? In 2017, Wellmont Health System doubled its net income. When they told you that if they didn't do this merger, our hospitals were going to close, they lied. It's just that simple. They lied. When you have a hospital system, a healthcare system, think about this. You have more than just hospitals. You have surgery centers, you have home health, you have hospice, you have physical rehabilitation. There's a lot of ways to gerrymander the data to make certain hospitals, specific hospitals, look bad. What if you order a bunch of your supplies from this one hospital and then divvy them out to other places? What if you do your hiring through another place over there? These are things that are legitimate. This did not have to happen. They scared you. They scared you. They said some big bad company is going to come in from the outside and they're going to dismantle everything and shut you down. And guess who the big outsider was? Say his name again. There you go. He got here January 2014, and 3 months later they were on a golf course talking about a copa. Folks, do you think that's coincidence or accident? It's not. It's not. The reason I wanted you all to come here, the reason why the people who have been peacefully protesting wanted you here is because the 50 of us can't do it by ourselves. Amen. And the 27,000 of you that have signed signatures who Ballard told somebody was only online, I think that's paper. I mean, where I went to school, it's paper. That's not online. Those are real people. Those are real families. Those are real lives. Those are real babies. Those are real mothers. And you matter. Every single person in this room and in this region matters. Before I go to EMS, I want to bring out somebody that I believe is the epitome of demonstrating that people matter. And all people matter in all walks of life, no matter where they come from, how much money is or isn't in their pocket, no matter what their mental health status is, and no matter if they have a place to live or don't. Pastor Will Shuey presides over Shades of Grace. And I first met him when Lou invited me to bring my grandbabies to their Easter celebration that was open to the public. And immediately I recognized a kindred spirit. And we teamed up a couple of times with some folks who needed some help. And I'm very grateful to know him as a human being. I am grateful that he is in this community. And I am grateful for his willingness to do for others what people who have a whole lot more position, power, and money don't do. So with that being said, please welcome Pastor Will Shuey.
Good evening, friends. Just want to take just a couple of minutes and say that I'm glad to be able to stand and in behalf of those whom we refer to at Shades of Grace United Methodist Congregation as the 4 L's, the last, least, lost, and lonely. And so we are a congregation downtown, a storefront church, barely a half a mile from our local medical center here. And so I deal with lots of issues on a daily basis and have for the 5 years that we have been in existence. But so often the folks are kind of left behind or left out, and we try to be there to defend them and help them and encourage them and to give them a place where they really do matter. And so I just wanted to share with you maybe just one morning in the life at Shades of Grace. We are open 6 days every week as a place. We feed about 30,000 meals every year. We're strictly by faith, 100%. But about 3 weeks ago on a rainy Monday morning. And we deal a lot with the drug addicts, the street people, the mentally ill, those who have kind of just lost their way in life. And on this particular rainy Monday morning, a gentleman came in, and I often talk to Danny and share with her stories, and she has come down to Shades of Grace, and I've gone and talked with her, and we've tried to meet needs and work out solutions for some of the folks. But on this particular morning, a man came in who obviously has mental issues. We've known him for the time that we've had the church there now. It's 5 years. And he'd been discharged from the hospital, still had his bracelet on, but somehow his shoes had been lost in his time in the emergency room, and he was released, and he walked down the hill to Shades of Grace in the rain with those little socks that you wear in the hospital, and there were holes in them, and he came in soaking wet. I asked him twice. He said, yeah, that's how I was sent out, and just so I came here. Within about 20 minutes, another lady came in who was very much a mentally ill person, and she had her bracelet on and had just been released from the hospital as well. And she still had all these kinds of electrodes and wires hooked all over her, you know. And so that happens quite a bit with the folks that we meet. And so I don't really know what I'm doing here other than the scripture says we are our brother's keeper, and we are one another's neighbor. And I want to be a good neighbor. I want to do the Lord's work, and we couldn't do it without community. And I'm glad to be a part of this community. And I just want to make a difference any way that I can from a perspective as a good citizen in the community, as a follower of Christ, and someone who just can try to make a difference in the people's lives. So not sure why I'm here other than just share a little bit of my experience, but I know that Danny can tell you a lot more of the situations that we deal with in trying to help those who sometimes don't know enough to help themselves. They don't know what step to take, and they're just back out on the streets, and they're back, lost in their own darkness. So thank you all for letting me just take a few minutes and share with you, and pray that God will bless all of us together. We live in a wonderful community. I love it here. I've been here, this is my 20th year since I came to the Tri-Cities. I lived in South Florida, in Miami. I know what the big city is like, and I love it here, and I want to be able to make a difference in some way. So thank you all for just letting me share my heart with you tonight. God bless you.
So Pastor Will and I, when we met shortly after that, we kind of connected. And I think the first time I called him for assistance was we were outside of the peaceful protest, and all of a sudden we saw a gentleman running down the street with an IV hanging out of his arm with a bracelet still on, and we were like, what in the world? And he had a severe infection on his arm and a lot of other things that were going on. And I was able to talk him down. He was a meth addict, and did get him to receive treatment and so forth. And I reached out to Pastor Will and I said, would you mind to come visit with him tomorrow morning? He was getting ready to go out of town, and he was like, but I'll stop by. And since then, we've connected when we see people in need who have been discharged and maybe been brought from Greenville by ambulance or Southwest Virginia, and then they're discharged and have no way home. And so we have organized, ways for people to get home. We've had, Kathy Christian and someone else from our peaceful protest take someone home, and we've just done a few other things like that in terms of getting prescriptions and things like that. So the reason why I asked him to be here is because it's a different view about the impact that our changing healthcare system is having on our community. You know, when you see more and more people who are being discharged with no way to get home to their loved ones, or who don't have the adequate supplies or medications that they need for their care, it's a guaranteed readmission, right? It's a guaranteed readmission when you don't send someone with the medications that they need, or make sure they get all the way well before they're out the door. You know, the stabilize and discharge might work, but it's going to present problems further down the road. And what we know is that 70% of our region is in, has government insurance, whether that's TRICARE, Medicare, or Medicaid. When you have readmissions within 30 days, and that continues to be a trend, their reimbursement rates go down, folks. So it will impact revenues long term. So those are the reasons why I asked him to be here. So if you feel led, speak with Pastor Will. He'll share lots of things with you. And as you can see, he's a lot kinder, maybe sometimes, than I can be. Okay, so now I want to move very quickly. So we're going to do EMS, patient stories, and questions and answers. And you heard Kelty and even Dr. Berry talk about hospital authorities. If you did not see, there's a printout at the front for you that actually talks about, it's Tennessee legislation that has already been passed about how a hospital authority can be created. Southwest Virginia already has one. So while this girl might not know all the ins and outs, what I do know is that we have the framework and the foundation to create our own. So my thought process is, and those folks that we've talked to say, yes, we want a voice. And let me ask you, do you want a say in your healthcare? Would you like a voice in your healthcare? Yes. Okay. So the way that we go about doing that, and one of the potential ways that we go about doing that, is establishing a hospital authority, okay? And so you hold public hearings, and you test the interests of people, and you decide like how that's going to happen, and then you choose who those people are going to be and how it's going to be structured. And then our hospital authority in Northeast Tennessee and the hospital authority in Southwest Virginia could team up together, and and then Ballad Health can determine whether or not it really wants to cooperate with its community, whether they really want to listen to us, or if they just want to be a monolithic monopoly that does whatever they want. Everybody says, well, find something positive to say. This is what I'm saying that I believe is positive. No one is saying we want Ballad Health to fail. I think Ballad Health failing is a scary thing for all of us, right? No one is saying that. What we are saying is that the people need a voice and a say in their health care, and we are not going to stop until we get it. Okay? All right, so I'm going to bring up now someone who you saw us probably back in the wintertime seeming like a tag team match at county commissioner meetings and board of supervisor meetings and all of that sort of thing, and rally for our very first rally for the Valley. And I wanted to bring him back because I believe that he has a lot to say and to be able to speak. I look at Tim sometimes as the Tennessee EMS side of things, who can speak more freely than maybe some of the other Tennessee EMS folks who, like our nurses and physicians, might feel restricted in their ability to be vocal about their concerns. And I do know, I think you also got a little bit of information. We reached out to Dr. Mickey Spivey as well. And so Tim is going to share with you both of those things right now. So welcome, Tim.
Well, I always say they bring the smart ones up before they bring me up because I jump around a lot and I just tell it like it is. One thing I'm done with is being politically correct about Ballad Health. So tonight I'm going to call out some names, like Colette George. Years ago, they're off Kingsport BMA. Pat Shaw, a lot of people in here supported him for mayor. Talked about Ballad Health. What's he done? 4 months. Kingsport BMA, gotta go. It's up to you folks to do that. We've talked about Alan Levine the people that were there before him that are still there. The Marvin Eichhorns, Eric Deaton's. They're deserting us. Eric Deaton was Wellmont, lived in Kingsport. His house is up for sale. He's moving to Johnson City. Why? So he can be closer to the hospital. He don't want to make that drive up 26. He don't want to have to go up 26 to save his life. So folks, if it ain't good enough for them, why should it be good enough for us? We've done this for 7, 8, 9 months now. Angie Stanley, Hunter Locke, and myself got together then. We met Danny. We bonded, and we've been all over this area. Dr. Spivey, who really wanted to be here tonight, but he's out of the country on vacation. But we started telling county governments, boards of supervisors, county commissions, that with these changes, people were going to die. And guess what? People have died. I can promise you that. I can promise you already people have died. Come October 1, more people. So Danny asked me to speak about some of the changes we've seen in Sullivan County, or that I've seen as part of the First Responder Network. And then this little dynamite thing coming up here, you think I'm blunt with you. She's going to get real blunt, and she's going to tell you about Southwest Virginia. But, you know, Ballot has lied to us. They made us promises of the magical comm center that was going to tell everybody where they need to go, which services were there, and it's just not fruition. They're making promises before they can implement changes and get them tested and get them processed. We've had traumas, level 1 traumas come into the hospital at Hostin Valley with no trauma team because information's not being passed along. Offload times, goodness. My mom, most of y'all know that, most of you in here are friends with me on Facebook, most of you know my mom was in the hospital a few months ago. She sat on a gurney an hour and 18 minutes to get into a room. What we're not thinking about is that EMS crew has to stay with her. They are still her primary care. So they can't turn her over. And so that's taken away from you or your mother or your sister or your brother that may need them. Because those crews, there's only so many crews in an area. Once they're exhausted, your backup has to come, then their backup has to come. And we're seeing that all over the county. We're seeing ambulances having to come from way up in the upper end of the county to the lower end because everything's tied up. That goes on quite frequently. Hold times in the ERs. I mean, this is just, you know, if somebody comes into the ER, my mom's a prime example, and I'm gonna get to Lindy White here in just a second. My mom was a prime example. She was admitted to the hospital, and the nurse came in and said, you know, you're admitted to the hospital, you need to go to step down ICU, but it'll probably be tomorrow. This was 6 o'clock in the afternoon. It'll probably be tomorrow before you can get there. Are the beds full? No, there's no staff, there's no nurse. So I make a little Facebook post about that. About 20 minutes, I get contacted by someone saying Lindy White wants my phone number. Please give it to her. And I started a dialogue with Lindy White that I felt went well. 5 months later, we were still waiting on a meeting that was supposed to take 2 weeks to set up. And a lot of you folks know, I shared those texts with Facebook about 3 weeks ago because, again, Lindy White was making promises. And Lindy's sweet. She's a very sweet person. And that's why people believe it. But in reality, she has not stood behind one thing she has told us yet. Not one thing. So when your mother or your sister goes to the hospital and you have a problem, I can assure you Lindy White's going to reach out to you. And she's going to make you feel oh so good. But nothing's going to happen. She's learning from the best. She's learning from the Alan Levine, the Eric Deaton, and the Marvin Eichmann. When Danny asked me to speak tonight, I sort of took it as last too raw. I got discouraged with everything we went through, with all the work we've done, and you can talk about these 27,000 signatures right here, but we had county governments representing 523,000 people that passed opposing resolution. And the state of Tennessee said, don't matter. The governor said, don't matter. The state representative said, it don't matter. Somebody is getting rich.
Yeah.
And they're getting rich off us. They're getting rich off our medical bills that are paying for the money that's being sent out. Delayed care, I mentioned, the increase in patient transports and transports between facilities has just resulted in EMS that will work. Every EMS station out there is, the folks are worn out. The overtime is killing them. They're worn out. They used to, on night shifts, you could get some sleep. They're not getting rest or sleep anymore. They're running all night long. And it's wearing them out, breaking them down, mentally, physically, and we're going to start seeing people leave those jobs because they can't do it anymore. And the sad part about it is when you look at a medical school at Northeast State, there may be 10 people in that class. And the ones that make it out of that class, they're going to go other places as well, Greene County, Washington County, Virginia. I mean, there's ample opportunity, so it's hard to backfill those positions. Folks, how many live in Sullivan County? For the first time in forever, we don't have a helicopter in Sullivan County. We don't have air evac in Sullivan County. How many of you knew that? Ballard One and Wings were the two air evac providers for the region for Ballard Health. They consolidated to one company, which is not a bad thing. Consolidation of services is not a bad thing, but we kept hearing everything. There used to be helicopter in Elizabeth, Johnson City, Greenville, Newport, I think now maybe Morristown, and then up in Southwest Virginia, but there was one at Bristol Motor Speedway. So we've heard we're not going to shut down the air station. We're not going to shut down the air station. We're not going to shut down the air station. That's Eric Deaton, by the way. And they didn't shut down the air station, but it's only going to be open during special events at Bristol Motor Speedway. So there's no helicopter in Bristol anymore. So Sullivan County is without an air evac completely. So now, in addition to wanting us to go 26, 27, 28 miles to Level 1 Trauma Center, they're taking away part of that transport opportunity. So now if you need a helicopter here on Stone Drive tonight, it's going to come from Johnson City, Elizabethton, Morristown, Newport, maybe even Abington with MedFly. So we've lost that. Why are our leaders in EMS being quiet? Anybody want to answer that? Caught up in the news, watched it, saw it? We're not seeing EMS leaders talk about it. We're seeing them talk about how good and how the changes have not really been that effective, not really been that bad. Well, that's because Ballard Health just bought Sullivan County $1.4 million worth of heart monitors. And it was all over the news. The thing they didn't tell you was that Wellmont did that every few years, right, Chris? Give you guys monitors every few years, didn't they? And I'm sure that money was COPA compliance money that had to be spent in a way. So you have the region's largest employer whose wives are connected to a husband who may be in EMS or may not be in EMS, and you've got folks in leadership medical companies that may be connected to a high ranking, those folks are not going to talk. It's going to be us. And I want to share with you just a little brief story of, we've heard Valley tout Niswangers for so long. It's about Niswangers. It's about a pediatric trauma center. Well, a 2-year-old presented at family primary care pediatrician with a fever, intermittent fever, progressed to a rash. Once it did and the fever didn't go away, the pediatrician had been treating, he immediately knew there was other things going up. And so she was sent to Niswangers immediately. And Niswangers did a little local intensivs at Niswangers, did a little workup, diagnosed her with hepatitis and febrile syndrome. Gave her a bolus of fluid, sent her home with antibiotics. Follow up if her eyes were to turn yellow, I kid you not, or her kidneys started shutting down. Fever progressed, back to the pediatrician. Pediatrician immediately sent her to East Tennessee Children's Hospital, where within an hour, this 2-year-old was being treated for Rocky Mountain spotted fever. Folks, this is where we're at. And I'm being asked to speed up, and I'm going to do that. But this is where we're at. We're hearing of people going to urgent care after sitting in ERs all night and not being seen, that are having major, massive health problems, brain bleeds, heart attacks, pulmonary embolisms. It's happening all the time, and they don't want you to know it. So some of the things I've said here tonight, you may not know what I'm talking about, but I will hear about it from other people tonight because I've called out some folks. And I'm sorry. I'm sorry that our efforts haven't worked. I'm sorry that at times we feel like, and I know Danny does as well, because we've done this so long, that we failed. But we don't have the money. We don't have the corruption to stop it. I hope that your voice, if we don't stop this, let's make a difference somewhere because of it. Let's get rid of the people that caused this problem for us. Let's do like our ancestors did on polling day and write them out the damn door on a pole. I got in this because of a 7-year-old. And I'm staying in it now because of a 2-year-old. And whatever it takes, we may not win, but they're going to damn sure know I've been there. So thank you.
You know, this healthcare issue has brought together a lot of very different people. And different relationships have formed. And you know, anytime you become friends or family with people, you have bumps in the road and all of that. Whether we disagree on anything else, we can all agree that our healthcare system needs to be fixed. It needs to be changed. You know, last week was scary for my family again because Bella got sick, you know, and She was misdiagnosed at a Ballot urgent care facility where we were told she had an ear infection, but her lungs were fine. Several hours later, her fever was 104.1. She couldn't keep anything down and she was struggling to breathe. So we took her to the emergency room where we were told, well, she's got some possible bronchial inflammation. We're going to give her a shot of Rocephin. Now, I don't know if you all know that Rocephin is an antibiotic, and antibiotics don't treat bronchitis, but whatever. So if she did have an ear infection, then hopefully that would do something for that. By the next morning, well, we left the emergency room at 3:15-ish in the morning. She'd had one wet diaper in 12 hours. We asked, when should we be concerned about dehydration? Because Rocephin gives you the runs. They call it the Rocephin runs. It can give you diarrhea. They couldn't give us a number of diapers to look for. Told us to use our own discretion. That's what the nurse told me, not kidding. That morning, by 8 a.m., I posted a video on my Facebook. Bella's literally going, and you can see her retracting right here as she's trying to breathe. And I called her pediatrician's office and they said, bring her now. And we did. And that was the first thorough examination we saw of Bella. And it turns out she has flu type A and pneumonia, not an ear infection and not bronchitis. Tim is in it for a 2-year-old. Bella's 2 as well. I think the babies might just save us all. What do you think? It is. So I appreciate you all. We're going to move into a couple of patient stories and then discussions, questions, and answers. I appreciate you all for hanging in here. I just feel like this is important, and we all need to become aware and be cognizant of the things that are happening. Yeah, I got her. Trust me, I got her. The next individual that's coming up, she is EMS from Southwest Virginia, and she's also a mama. And you're not going to make me cry. When you do this for as long as we've done this, you hear so many stories every day. I can't even look at your face. I'm sorry. We will win. We will win. It's not fair. Because it's the right thing. And I believe that right will win. I just can't live my life as a cynic or I might as well be dead. So I'm going to have Chris Hill come up and talk to you as an emergency responder in Southwest Virginia, as a mom, and as someone who sees this firsthand on several different levels. Chris, come on up. Y'all been welcome.
I'm sorry for the way I look. I'll just hold it. It's been a long, trying day. I've lost a family member this morning, so I'm going to really try not to be too emotional. I'm not going to make any promises. As a first responder in Southwest Virginia, losing this trauma center, I don't really know how to put words to how important that this is. Our trauma was designed for people that have possible injuries. That way, when they are hurt, if they're severely hurt, they can get to a facility that have the appropriate ways to treat people. If those specialties are not there, it's gonna be so hard for people to meet that golden hour. I'm sure everybody knows what golden hour is. Coming from Southwest Virginia, whenever we have to take one per our protocols, we have to go to a level 1 or a 2. Sometimes where we're located, we have narrow one-lane dirt roads. You know, where we are located, sometimes it's trying to get to that golden hour, to make sure we get to a facility in that golden hour. And then now, you know, in a perfect world, we can fly every day, but it's not a perfect world. There are many times that we don't get to fly every day. Weather, I mean, helicopter malfunction. I mean, there are several different things that can keep us from flying that patient. So with our protocols, if we can't go to a level 1 or a 2 facility, we're coming to Holston Valley. So without those specialties, you know, you may or you may not be stabilized. And then you're going to be transferred to Johnson City, where you're going to receive another transport bill. You're going to receive another hospital bill. It's going to be more bills, more cost on that patient or that patient's family if they don't make it. So, you know, as an EMS provider, I was worried before March 28th. March 28th, my daughter was involved in a very serious head-on collision. She had gotten married 19 days before. That's her. That's my baby. 19 days later, this is what she survived. When I arrived, my child was still pinned inside the car. It took about 30 minutes to get her out of the car. So she was flown to Holston Valley. Thank God we still have that level 1 facility at that time. Not a lot of her injuries did resolve themselves because God, number 1, because God. Number 2 was that facility. She had 4 different injuries. Without going into a lot of detail on her injuries, she had 4 different injuries that anyone alone by herself could have killed her, and probably should have killed her. One of which they needed to do emergency surgery. They asked, you know, sign here, do what we gotta do. But here's the thing. She was so broken that if they had went in normally the way they would have somebody else, it would have killed her. They did not know until they got inside through a different procedure in the cath lab that the bleeding had stopped on its own. God. Now, another facility that didn't have the specialties, and that specialty in particular, how do I know they wouldn't have, and there's all kinds of what ifs, I understand that. But, you know, opening her up with a surgery that normally they would have. Thank God they didn't, because they're there. This is when she come home. For 3 months, she couldn't walk. For 2 months, she was non-weight bearing on 3 of our 4 extremities. And here's when she stood up for the first time. Lord, my child is strong. And a lot of this is her. You know, she done this. She's tough. But as a mother and as an EMS provider, I could not imagine my child going any second further up the road. Because when they put her on the helicopter, I did not know if I would see her again alive. I honestly didn't know. And you know, the next time, it's always going to be somebody's child. It's always going to be somebody's loved one. It's always going to be somebody in this room, possibly a family member, somebody that you love. We need to keep our care. We need to keep it. And our voices need to be heard. Our stories need to be heard. We have to advocate for ourselves. We have to advocate for our families. This is just wrong. Ethically, morally, it's the way things are being done, the way people are being treated. It's wrong. And it's only up to us to make sure that we can make it right. Hang in there and keep going.
Okay, so one of the things that we've heard a lot about is the billing issues and care issues. You've heard Tim talk about NICEWONGER, and you've heard other folks talk about NICEWONGER and specialties, and that was one of the big selling points about downgrading the NICU, right? Was we're going to recruit all of these pediatric specialties and subspecialties and have all of these things available to you, and yet we're hearing time after time, day after day, that those things aren't available. What happens when you're a parent and those things aren't available and Ballad decides to sue you? Danielle, if you'll come up and talk.
Hi, I'm Danielle Sparrow. This is Campbell. I'm a single mother. I just adopted 3. And I also have 3 foster children. So I have 6 in my household. Campbell has special needs. And when he was born, I knew it, but I decided to continue on with the adoption. He sees most of the specialists in Knoxville now because we don't have them here. We don't have pulmonology. We don't have neurology. We had a ear, nose, and throat doctor, but he referred us to Knoxville because his case is so complicated. We see sleep study in Knoxville. The only one that we see still here in the Tri-Cities, besides his PCP, is genetics. When I take him to the ER, they tell me that there's nothing wrong with him. We went one night, he woke up at 4 a.m. gasping for air. And I took him on in because I thought he had sleep apnea. I was basically laughed out of the emergency room. Told me babies don't have sleep apnea. I decided to make an appointment in Knoxville. He had a sleep study test and he did come back with sleep apnea. He has He has a minimum of 4 appointments a week. We have PT on Monday, speech and feeding on Tuesdays and Thursdays, and OT on Wednesdays, plus the specialty appointments. I've had to quit my job. I work Instacart, which is a delivery service for groceries, because I have to be at every appointment to see that he does get progress, he does succeed in life. received a summons last week from a constable that I'm being sued by Ballard because I wasn't making payments on time. So here I am, just adopted 3 children, working basically, it's called self-employment, working as much as I can, and now I'm being sued. What do I do? I can't go to work because if I go to work, he doesn't get services. So we're kind of at a crossroads. He has a syndrome called Smith-Magenis syndrome. There's 600 worldwide. It's a deletion of chromosome 17. And in that deletion, he's missing 3.7 million genes. He's 17 months. He just started army crawling. He's still on formula, baby food, nonverbal. He has periods where he stops breathing. And when I go to Niswonger, they tell me everything I'm saying is not true. When I go to Knoxville, they say everything that I'm saying makes perfect sense to them. So now we drive an hour and a half each way for a 20, 30-minute appointment. But they listen there. They don't think I'm just some crazy, overprotective mom. We've been in Knoxville all day for appointments today, and we'll return again tomorrow. I have, let's see, the kids in my home are 15, 12, 9, 5, 3, and 1. In his syndrome, he's got a deletion of melatonin, so he does not sleep. There's times I'll put him to bed at 7, and he's up at 11, and that's the end of it for us. He will probably walk when he is 5, and he'll probably most likely be always nonverbal. Most kids, when I met with the geneticist in Johnson City, he told me to join a support group because this is the hardest genetic syndrome out there. He said most parents, by the time their children are 12, institutionalize them. We tried it. I've been on the waiting list now for behavior specialists. They tell me he doesn't qualify because he's not the age of 2. He headbangs, he hits, he bites, he pulls hair, but they won't give me a behavior specialist yet. Thank you.
I know of several families who foster and who, because of medical conditions, have considered moving outside of the area because of the lack of pediatric specialties and subspecialties that we have at our children's hospital. The thing that baffled me when the Tennessee Department of Health said you can downgrade the NICU, and that in their report on Ballad Health in May, they actually said that they had concerns about Ballad's ability to recruit the pediatric specialties and subspecialists that they said they could. And my thing is, if you have concerns about their ability to recruit, why in the world would you want to get rid of what we already have? It just doesn't make sense to me. Next, I'm going to bring up a grandmother who I first heard from, back in January. And when she reached out to me, they weren't really sure what they were going to do legality-wise. They weren't really sure what was going to happen with her grandbaby. And so all I could share on Facebook Live was that a baby had been born, that 2 days later when the baby was supposed to be discharged, they said, "We think your baby's been having seizures." And then transport took a really long time, and I couldn't be very specific because I wanted to be respectful, let the family figure out what they needed, what worked for them, what was good for them. And they are at a space now where they are ready to share. This story is incredibly important as we consider downgrading the NICU. We have two very, very huge things about to happen, right? Losing this NICU Monday, when people aren't properly trained, where equipment hasn't been properly tested, where it's just not the right thing to do. And then 30 days later, they want to take away our level 1 trauma center. They literally are gutting our hospital is what is happening. And if you hear this story and you think about the fact, just listen to what she tells you. Listen to how long it took for transport. Listen to all of those things, and then imagine what it's going to be like when they have an additional 168 to 180 transports on their plate at Niswonger Children's Hospital for their NICU, because that's how many babies at Holston Valley last year needed NICU care, even if they were over 35 weeks. It was actually 300 babies total. That's how many babies were in Holston Valley's NICU last year. So even if they keep some of them, what are they going to do with the rest? Cindy, if you'll come on up.
I'm a nurse. I'm a nurse manager. Tonight I'm coming as a grandmother. I'm coming to tell my story, a story from my grandson, who is 8 months old. His name is Corbin. And because he can't tell the story, I want to tell the story. And he was born in December we are from Greene County, and he was born in December at Tacoma Hospital. And this was the time frame that they were consolidating Laughlin and Tacoma, and they were already moving the OB services over to Laughlin. So my daughter-in-law had a normal pregnancy, no complications at all. He was born full term. And the day we went for her to have the baby, when we got there, me and my husband, the first thing, being a nurse manager, the first thing I noticed was, where's the staff? Where is all of the staff on this floor? And I never saw over 2 nurses on that whole unit the whole time we were there, that whole weekend. He was born around 2 o'clock on Friday afternoon. And we noticed pretty much immediately that there was something wrong with the baby. He was very irritable. He was not eating. He was arching. He was postured. And he would just stare. He would just stare off into space. And this was seizures. This baby was having seizures. And I looked for a nurse manager, couldn't find one, never did find one. And her doctor wanted to release her 24 hours, let her and that baby go home at 24 hours. That would have sent my son and my daughter-in-law home as brand new parents with a baby having seizures. Thank God another OB doctor came on, called that weekend, and he said, no, new mamas, I like to keep them a couple of nights just to let them get used to being a mama. And so Saturday goes by, we're still seeing the same symptoms as before, nothing being done about it. And people, you can't just get a baby and walk out of the hospital. They won't let you do that. And so Sunday, another pediatrician comes on and he tells my son and daughter-in-law, this baby's having seizures. This is what's happened. And this was about 10 o'clock Sunday morning. And so me and my husband, we go straight to Niswonger because we are from Greene County, so that would be the hospital they sent him to. We go straight there, and it takes about 30 minutes to get from Greenville to Niswonger. They never showed up with the baby. And So we're waiting, and they keep telling my son and my daughter-in-law there is not a transport nurse available at that hospital to come and get this baby. So this was 10 o'clock in the morning. He finally got to Niswonger at 6:30 p.m. that night. He laid in that hospital from Friday at 2 o'clock until Sunday at 6:30, having seizures, no treatment. They don't have the NICU at Tacoma to even treat the baby. He was born with an Apgar of 4 and had to be resuscitated. Why didn't they send my baby, my little grandson, to Niswonger immediately? I don't know. There's so many whys that I'm asking now as a nurse. But, so he's born with an Apgar of 4. Finally, they get him to Niswonger on Sunday night, and they do an MRI, and he has severe brain damage, HIE. And that's caused from lack of blood flow and oxygen to the brain during labor and delivery. The only treatment for that is within the first few hours of life after he's born. And it's a cooling therapy that they cool the baby's temperature to try to help the brain damage. Well, we're way past that time frame, way past it at this point, because we're now over 48 hours away, after his birth. So he's in that NICU for about 2 weeks. He goes home on 3 very, very strong seizure medications. At this point, we don't know. We don't know what the outcome was going to be. So we hear my daughter-in-law and my son take home this newborn baby, their first baby, on 3 strong seizure medications. And he's followed by the pediatric neurologist up in Johnson City until he's 3 months old. And she decides to leave. So Ballad, at that point, they're just going to bring in pediatric neurology 2 months at a time. And she's like, this baby's got to go to Knoxville. She said, he's going to have to be followed, consistent care. You can't just bring a doctor in for 2 months, send him away, and then have a new doctor take over. He needs to be followed closely. So we transferred all of his care to Knoxville. That's where he goes now for all of his care. At 6 months old, he was diagnosed. Because of the brain damage, he now has a diagnosis of spastic cerebral palsy at 6 months old. The spastic quadriplegia part of it is that it affects all 4 limbs, both arms and both legs. So now he has the diagnosis. He's 8 months old. He can't sit up on his own yet. He can't grab a toy and play with it. As a nurse, I'm looking back and I'm like, it makes me mad. The nurse in me is mad because of the quality of health care that our babies are receiving. But as a grandmother, I'm hurt because now we have an 8-month-old grandson. We don't know if he'll ever be able to walk. We don't know if he'll ever be able to play ball with his cousins. Will he even be able to hold a fork and eat? Will he be able to tell me that he loves me, those sweetest words that a grandmother can hear? Or will he even be able to give me a hug? I don't know. We're in that period. They said it'll be 2 years down the road before we'll know how severe it's going to be. But I can tell you, we've decided we want his story told because we can't go back and change his outcome. It's happened. We will deal with that, love him, and go forward. But we can tell the story. We can tell the story that maybe it'll save one of your babies or your grandchild from this happening to them. So if I had that ballot board before me right now, the one thing that I would ask is
Scott Niswonger. You put your name on that hospital and you say you're doing what's best for those babies. You come and walk a day in the life of my grandson. You go to all of his therapies. You go to Knoxville all the time for all of his treatments. Come see what it's like to be my son and my daughter-in-law. Walk a day in their shoes, Scott Niswonger, then you might make different decisions on that board.
We don't have access to quality health care. We have not consolidated. We have diminished. We have depleted. This is why it's not okay. This is why I'm asking you all to go home and talk to your neighbors. Drag your friends out the door. Tell your church people don't worry about being offensive. Tell people it's okay to not have Southern hospitality. It's okay to rock the boat. Because your babies and your loved ones and your family members are needing, they're relying on you to do it. And you're here tonight when other people aren't. So I nominate you. You kind of volunteered, right? Each of you has stepped up in your own way by being here tonight, so I'm asking you to go home and take that charge forward. I want to hear from one more patient story before we get into some question and answer session, because we've gone a little bit longer than I originally intended. But we've heard several different stories. How many of you guys have heard about children who needed appendectomies and were told they needed to go to Niswonger Children's Hospital, and then something happened to those children along the way? How many of you guys have heard stories like that? Okay, so I want to introduce you to Kathy Christian, who is a grandmother. We seem to be the night of grandmothers, don't we? She's also my battle buddy. She's been with me since day 2 at the peaceful protest. Our wives are very similar in that regard, and I'll let her share with you the experience of her grandson, and then we'll talk some more about what we can do to save our healthcare system. And we'll hear from Commissioner Angie Stanley as well.
Well, it has been 118 days since I have slept in my own bed. And thank you, but I'm not anything other than someone who is trying to do what's right for our community. Just to hear that grandmother and her story breaks my heart, but it reinforces why we have to have a peaceful protest. My grandson went to Indian Path August 5th of last year. We thought that he just had a stomach virus because, he was throwing up, and, my daughter called me and said, I'm going to take him to Indian Path because I just think he needs fluids, because that's what's happened in the past. I live in Churchill and she was in Kingsport, and I just had that, when you get that little feeling that you got to do something. And so she said, "Don't worry, don't come, Mom," and it was like, no, I'm supposed to be there. So by the time I get to Churchill, which is approximately 17 minutes, and I go to his room, and my daughter says, they say he's got a problem with his appendix. And so I went in, and we had 3 different medical professionals that came in and said that they had looked at the tests, and he had acute appendicitis and needed to have his appendix removed now. But they said, you need to go to Niswonger Children's Hospital. Now, at that time, I wasn't really aware of what was going on with Valley. I had vaguely heard about the merger, and of course, my thought was, well, that's not a good idea. But beyond that, I really didn't have any education. I had no idea, how bad it was. And so my daughter looked at me and she said, should we take him to Niswonger? And I said, and I think this is extremely important because we all feel this way, Marianne, we've had 3 medical professionals that have told us that he needs to go to Niswonger, so let's take him to Niswonger. Let me say, we were not given a choice. I mean, it wasn't, you can either take him to Niswonger or Holston Valley, or we could do it here. It was, you need to take him to Niswonger Children's Hospital. And like I said, I just said, 3 medical professionals have told us we need to go to Niswonger's. So we said, okay, and we were gonna take him to Niswonger's. And he was like, no, we can't let you take him from the hospital. He needs to go by ambulance, which scared us to pieces. And by the way, the ambulance ride was $860. And at that time, we didn't have insurance on Jalen. So anyway, trying to make this long story short, which I don't do well, we took him to, we followed the ambulance up. Now, he had acute appendicitis. By the time we got to Johnson City Medical and they took him through the testing again, the appendix had ruptured. They rushed him into surgery, and immediately, I have to say, within 30 minutes of getting to Johnson City Medical, he was in surgery. They had to flush his system 3 times to get the infection out of his gut. He developed E. coli. He was in and out of the hospital for 19 days. I want to know why they sent him to Johnson City. Holston Valley, 5 minutes across town. An appendectomy is usually 3 days, in and out, and you're home, no problems. 19 days in and out of the hospital. He was admitted and released a total of 3 times. And praise God, he's okay. Still has some, he had walking pneumonia and went for a shot and just about went through the roof. He was poked and prodded, and it was scary how sick he was. And I don't think we realized until after it was over with that he could have died. He could have died. And all they had to do was either do a simple appendectomy at Indian Path or send him to Holston Valley, which is a trauma 1, which had 4 surgeons, and it would have been fine. So I just want to tell you how important it is for us to continue to fight. The newsletter that you have has everything that you need to get in touch with the officials that make a difference. Call, don't text, call, send emails, write letters, and raise a stink. This has already killed people and will continue to kill people until we get something done.
All right, so I'm going to wrap this up. Some of you saw a Facebook Live that I did several weeks ago with a very lively individual who a lot of the community is familiar with. And tonight you've heard a lot of like child stories, baby stories, but we do have an aging population. We do have a lot of folks that have other conditions. And so I want to give Shauna House, I almost gave your whole Facebook name, Shauna House a chance to recap a little bit about what she saw, not just what happened with her mother, but what she witnessed in our emergency rooms where Ballot Health talks about nursing shortages and things aren't that bad and wait times aren't that bad. I'll let her share with you that experience, her meeting with Lindy White, and then what has happened since then. So Shauna, if you'll come on up.
I'll try to keep composure tonight. My son's warned me, Mom, be professional. Don't act like you do when you get upset. So I'll try not to do that. I had to take my mother to the emergency room on July the 22nd. She had failed. She'd actually failed 3 times that week. And so I decided that I needed to take her to the emergency room because she couldn't walk. She was having chest pains. She was just having a lot of difficulty. She's a type 1 diabetic. She's 73 years old and she's had 4 heart attacks. So I go to the emergency room. It's a little after lunchtime. I can't remember exactly what time it was. And I go in and I said I needed a wheelchair and told them what happened. And they were like, well, you're gonna have to wait on a wheelchair. It's like, okay. See, I had no idea all this stuff was going on. So then I see a wheelchair over in the corner that somebody had just came in and got. So I got it and went and got Mom, and I came back and I told them what had happened, and they were like, okay. So we go sit down. We wait. Then they call us back, and I go back there with her, and they were like, what's the problem? And I tell them about her chest pains, I tell them about everything. So they check her blood pressure, and they check her sugar, and we'll be with you in a little bit. We wait. And people are coming in, just constantly coming in. And I'm starting thinking, what in the world? Why are we waiting so long? So after about 2.5 hours, this man comes over to me and his leg's amputated, and at the end of it, it's bleeding and has all kinds of, I don't know, coming out of it. And he comes over to me and he puts his hand on my knee and he said, ma'am, he said, can you take me home? He said, my leg burst open in the middle of the night. He said, I'm a diabetic and I had my leg amputated last week. And it was bleeding all over the bed. And he lived in the project homes down below the hospital, and he wheeled himself to the emergency room. And I said, well, you waited. He said, I've been here since 3 in the morning or something like that. So now it's probably about 2 o'clock. And I was like, well, you've waited this long. Why don't you just go ahead and wait just a little bit longer? He said, but I can't, I'm too weak. And then I noticed the beads of sweat, and he said, I just need to go home. I said, well, what's your name? And he told me, and so I go back up to the front, and I was like, look, you've got a diabetic over here, his leg's been amputated, I think he's about to go in and have a weak spell. You know, can y'all not just go ahead and push him forward? And the guy says, he's gonna have to wait like everybody else. And I said, excuse me, but he's a diabetic. I believe he's having a weak spell. Can you get him some juice or crackers or something? Ma'am, we're doing the best we can. You need to have a seat. Excuse me, but he really needs some care over here. Noted. So I go back over and I lied to the man. I said, can you just wait a little while longer? I said, just wait a little while longer. So he waits and he comes back over, and this was the day that all the storms were coming in. And he said, if you can't take me home, do you have an umbrella? And I was like, you can't go home with this umbrella. I said, I have an umbrella, but it's out in the car. And he said, I just can't take it anymore. And I said, think of this. It's storming, it's raining. If you go take your wheelchair and you go out and you try to go down this hill, you could lose control, you could dump yourself out onto the road, you could hit your head, kill yourself, or hit your leg and bleed out right there. So he starts to get upset, and I said, can I go to the vending machine and get you something? So he wheels himself back over, and guys, 2 hours later, they take him back. And they just patched his leg up, and he came out and he grabbed me and he said, "What's your name?" And I told him, and he said, "Thank you for trying to help me." I said, "Okay." So I'm starting to get a little upset because it's taken so long for Mom. And so finally I asked if they could check my mom's sugar because it was taking so long. And so I wheel her up there and I was like, "We need to check her sugar." And so they couldn't find a sugar checker. Then they find the sugar checker, and the girl opens up the little thing of strips and puts it in, and it doesn't work. And then she gets another one, and it doesn't work. And she throws that roll of strips in the trash. And I'm thinking, "I hope you're not charging Mom for all that." She gets out a note. It took 3 times. It still didn't work. "Excuse me, I'll be right back." She had to go get some more batteries. She was gone. How long comes back? They finally checked Mom's sugar. So I had to go get Mom some stuff from the vending machine. So then they come and get her, and it's time for her to go have x-rays on her knees. They never once done a EKG or done anything about her heart. But they go take her to have her knees x-rayed, and they come back, we bring her back up, and we wait, and we wait, and we wait. And while we're waiting, a guy comes in, and he's all frantically upset, and he's taking his shirt off, and he's covered with blood. Covered with blood. I mean, if you looked at the front of him, you couldn't tell what color shorts he had on. So he takes his shirt off, and they go back, and they do his little blood pressure check or whatever, give him a pillow, give him a blanket, and back out in the emergency room. I said, "Mom, don't touch nothing." So he's in pain, so he's running from seat to seat to seat, sitting, grabbing his head, touching his bloody pants, touching the seats, just losing his mind. And I'm just like, okay, he's gonna go off on somebody in a minute. And he goes over and he lays down into the chairs, on 4 chairs, puts his pillow down, and he lays down in those seats. And he lays there for about 30 minutes. Everybody's uneasy because he doesn't act too mentally stable. So finally he gets up, and I guess he went to the bathroom, but he took his pillow and his blanket with him. Now, guys, blood's all over these seats. Okay? Everybody there saw it. A grandmother comes in with her little 3-year-old grandson, with another lady who I think they were kin, because the little girl was playing with the little boy. And the little boy has a car, and the little girl has a book. They get down on their knees, and they're playing in the seat where the guy was laying with the blood. And I said, "Ma'am, you don't need to let them play right there." Of course, she's looking at me like, "Here, you'd be telling me that." And I was like, "There's a playroom back there." So finally they get up and go in there, but they've already been running their cars over the seats and all this bunch of stuff, and who knows, I mean, he could have not had anything in his blood, but then again, he could have had hepatitis, he could have had AIDS, he could have had whatever, okay? So finally, I'm sitting there, and there's another lady whose husband's just in a lot of pain, and I'm like, "Where's the manager? Where's somebody that can help us here?" Nobody's here. So she said, "Let's just call over here to Indian Path and see if we can go over there." So she calls, and they said, "Grass ain't greener over here. Don't come over here. We're taking the overflow from there." So we called Johnson City, same thing. "Don't come up here. We're too full." So finally, a nurse comes by, and she says, "Hey, there's one big red right over there." Well, the lady beside me said, "You want to take care of it, or you want me to?" And she said, "I'll take care of it." So she goes over and pretty much lays into them. And in about 5 minutes, they come out offering all of us pillows and blankets. So then they come rushing back out, and they said, "Okay, where's Miss Bear? Where's Miss Bear?" And I was like, "Right here." She goes, "Okay, what's happening? Is she getting worse? Is she getting worse?" And I was like, "Okay. We need to take her back down and have more x-rays." I said, "On what?" I said, "On her knees." I said, "Well, we're not sure what's really wrong with her. Her back's killing her too. Well, we gotta have to do it on her knees." So they go back down there and come back out. And I said, "Mom, what did they do?" Took the same x-rays. Okay? In the meantime, there was another lady who had just come in who had fallen, was a little bit older than Mom, or looked it anyway, and she had fell and messed her legs up and back. So I think they thought they were getting her instead of mom, and got my mom instead. So to make a long story short, we're sitting there and we're sitting there and we're sitting there, and it's crazy. It's just crazy. And I put out a little Facebook thing saying somebody needs to pray for me and do it real quick because I'm about to lose composure up here in this emergency room. I had no idea that I was about to step into a hornet's nest. So all of a sudden, a doctor and a nurse comes out and said, okay, we got to clear out some of this emergency room. I mean, there wasn't an empty seat anywhere. Anywhere. He says, we're going to do some quick fixes. If you are not about to die or something very, very bad is going on with you, we're going to get you comfortable and then you can go see your doctor in the morning. Great, another copay. So they start calling out patients' names, and there's about, I don't know, 6 or 8 of us, and the mom's one of them. We wheeled it back there, and we're all sitting back there together. Probably like I'm sitting here, Danny's right there, there's another patient here, another patient over here. The guy walks up and the doctor says, all right, Miss Bear, we've looked at your x-rays and you have the legs of an 18-year-old, so great news. And I guess probably I was a little bit disrespectful. I said, dude, he said she's 73 years old and she can't even walk. What do you mean she's got the legs of an 18-year-old? Okay, so Shauna's not acting in the spirit at this time, she's acting in the flesh. And I said, wrong. We all know who says that, right? Wrong. So he said, well, okay, can you tell me what's going on with you then? So my mom goes and says, well, you know, I don't really know what's going on. I fell 3 times and my legs are killing me, my back is killing me, my chest is killing me, but I don't know. And she touches back here and she says, I don't know if this is my lower back or my kidneys that are hurting. And the doctor grabs my mom's hands. And I love my mama. Okay? I love my mama. He grabs my mama's hand and said, that is not your back. This is your back down here. This is your kidneys up here. So get it right. Your kidneys are up here and your back's down here. And I was like, dude. I was like, does it really matter if my mama gets exactly where her kidneys are located at or not? I said, you're the doctor. Check her out and let's figure out what's wrong with her. She's in some serious pain here. And by the way, y'all haven't done anything to check her heart. He said, well, okay. And then I said, her left knee is swollen real big. You know, I don't know what's going on here. So he looks at my mom's knee and he touches it. Doesn't touch the other knee, just the left one. And he looks at me and he says, okay, she's, okay, Miss Bear, I'm gonna pull your leg up and it's probably gonna hurt. So just bear with me. He picks mom's leg up. Of course, mom hollers out and, okay. All right, okay, so you're gonna need double knee surgery. Okay, is this your daughter here? Said, go ahead and get your phone out. I'm going to give you the names of the doctors, and I still have it in my phone. And I said, why do you think she needs double knee surgery? Because she didn't even touch her right leg. He said, because I know. He said, because my wife's going through the same thing. He said, you can either listen to me or you can wait another 8.5 hours because that's how far backed up we are. My mom never did make it back to the emergency room. He said, now, if you'll have to wait before we can give her a full examination, or we can just give her something to keep her comfortable and then you can go tomorrow to her main doctor. And I was like, double knee surgery? He said, look, if you don't want her to have surgery, then you can give her these protein shots. They're $500 a shot, but insurance don't pay for it. So, okay, this is what we're going to do. We're going to give her prednisone. You don't give her type 1 diabetic prednisone. That's going to shoot her sugar out the roof. Okay, I know that. And then we're going to give her some more dabs. Okay, so you're going to give my 73-year-old mama, who's had 4 heart attacks and a type 1 diabetic. Have you not looked at her chart, sir? He's like, we look at charts here. I said, did you look at my mama's chart? We looked at charts here. I said, okay, all right, so you're gonna send my mama home with prednisone and a narcotic, shoot her sugar out the roof, and he said, so check it more often. I said, dude, you don't understand what's about to happen. I'm about to get upset with you. Look, this is how it is. We are busy. So you can take this, and you give her this, and you give her this, and then take her to the doctor tomorrow. If something happens that her sugar gets out of control, bring her back up here. Bring her back up here for what? Another 10-hour wait? Are you serious? Well, that's just the way it is right now. There's nothing we can do about it. We're short on staff, and this is all we can do. Or you can wait, because we just took in 200 admissions, is what I was told. We had 4 beds available. Won't have nurses upstairs to take care of them. Because all the people that were in there, in the beds, in the emergency room, had been there all night long anyway, and still hadn't got a room. Now, during this time that I'm sitting out there, and I'm watching all this go on, they finally come out and start calling a few people back. And so I'm just going to make up a name. They're like, Jimmy John, come out here. Jimmy John. And everybody's just sitting there, you know. And then finally some guy hollers in the back. He died 2 hours ago. He's laying over here in the corner. So, guys, I'm telling you, Hollywood can't make this stuff up. So I'm getting very, very, very upset. So we're sitting there. 30 minutes later, I'm like, what are we doing? And she was like, I hollered at one of the nurses. I was like, okay, what are we doing here? I was like, he told us 30 minutes ago he was going to give Mom these prednisone and Lortabs, and we were going to go to the house. I was like, we're still sitting here. Oh, did he release you? Well, yeah, he did. So, okay, well, let me go find a doctor. 20 minutes later, here comes a lady with some papers. So she says, okay, so we're going to make you sign this, and this means this. So I sign it because I had a power of attorney over Mom, because Mom was shaking so bad she couldn't even write. And, okay, this is over here. Oh, and this is your right to privacy. This is saying that we will keep, you know, privacy, blah, blah, blah. So I, being a smart aleck, picked a pen up and I went, not much privacy going on around here. I know all about her, and I know all about me. But okay. So I hurry up and get out because I'm about to lose my mind. And I walk out the door, and all of a sudden, my phone starts blowing up. I even had a government official send me the first text. Shona, I can't believe that you're going through this. I have called and made people aware of what's going on. I was like, okay. All right, so I take my mom to the doctor the next day with another copay. And the doctor brings in the x-ray tech who can actually read x-rays as well. And I told him what happened, and they take Mom back. He comes back, they read Mom's x-rays. She has absolutely nothing wrong with her knees. Nothing. So we had to take her for an MRI. My mom has 7 bulging discs from where she fell. She's been in pain all this time. She's still in pain. I had to go back over there in the middle of the night last night. They still haven't even got her an appointment to see anybody, but they told me that she needed back surgery. Never did check her heart. Never did anything. So I wrote up a big Facebook post, and I was like, I'm sick and tired of all this mess. What in the world's going on here? Still didn't realize that even Danny and them had been out there doing all this, because I hadn't even been in town. And I said, well, I'd like to start with Miss Lindy White. I'd like to take her out to lunch, and I'll fix dessert. Because I'm a cake lady. The next day, I get a phone call. Faith Vacation Catering, I'd like to speak with Shona House, please. This is she. This is Miss Lindy White. I said, great, you gonna take me up on my offer to go to lunch? She goes, yes, I am, as a matter of fact. Or you can just come up here and we can explain to you how well we are doing with our healthcare system. Well, you see, she was just upset because that post got 924 opinions, 700 and something comments, and 1,200 and something shares. He's working for Danny. Danny? Who's Danny? Yep, they thought I was working, that she hired me to just do all this.
Well, I didn't even know that part. Well, no, they think somebody hired me too, so welcome to the party.
So anyway, people forget I know a lot of people, and so I got about 60 or 70 friends that are nurses. So then I started getting all kinds of phone calls, and it was like, Shawn, you can't tell that I called, okay, because I'll get fired. But do you know they're having meetings about you? I said, what? I said, yeah, they're having meetings about you. I said, meetings about me for what? I said, yeah, they're having floor meetings saying that if they like your post or comment on your post, they will be fired. I was like, what? Yeah. And this came from people that are very well in the nurses and all that kind of stuff. So I go to a meeting with Lindy White, just to make a long story short, and it's recording, and I take my son with me to Landon to help me keep composure because I get a little out of control. But so I done okay with her, but she tried to put the words in my mouth, and she tried to tell me that things that I said happened didn't happen. And then finally, she just basically called me a liar, which did not go over well. And I told her, I said, are there not cameras? Go get the cameras. Go get the cameras, pull the cameras, look at the cameras. There's no way I can lie if you've got the cameras. Go get the cameras. Oh, we will. We will figure all of this out. We will figure all this out. And the part about the blood on the seats, there's no way. I was like, excuse me, no way. I'm the one who's sitting there silent. I said, you know what? If you call all the rest of them in there, and I got some of their names, all this stuff's wrote down, you know. I said, I can probably find these people because they saw it too. I said, what I think you need to do is call the grandmother and the other lady that had the two little kids that were playing in those bloody seats, getting that stuff all over them, because bloodborne pathogens last for like 3 weeks, even with dried blood. She goes, there's no way, because we have an LPN that stays out in the emergency room, and they make sure that none of that kind of stuff happens, and they make sure that everybody's comfortable and everything goes the way it needs to go. I said, now you're lying. Because there wasn't nobody out there like that nowhere. And I bet right now, and this is a week later, having this meeting with you, I bet them seats still ain't been cleaned. I made every complaint that I could make. I called everywhere I could call. I sent every letter that I could send. I've gotten one response. HIPAA did show up at the meeting with Lindy. So Lindy calls me the next day and she goes, well, I just want you to know, because of your complaint and you're making us aware of what's going on, we're going to put up a glass wall in the emergency room, all because of you. So don't try to blow smoke, honey. I really don't care. I was like, what I do care about is that you all are not paying attention to what's happening here. I was like, your management team sucks. I said, overworked nurses, overworked doctors. And you know what? I don't even blame the doctor that was misdiagnosing my mom. They didn't even know. They were so tired and overworked, I don't even know how they know what end was up. Nurses, during the shift change, I got to watch the shift change. And these nurses were trying to get out of here just as fast as they could, and these nurses were coming in, and as they were telling them what was going on and how far they were backed up, these nurses were just throwing up their hands and just going on. What if there had been a real emergency? What if school would have been in and we'd had a school shooting? What would you have done then, Lindy? Oh, well, we have backup plans. When the emergency room gets a certain amount of people in it, then we have a call system. I get a phone call, and we come in, and we make sure that things get put in proper perspective and things run smoothly. I thought, where was you at on the 22nd? had a government official come to my home to try to explain to me what was happening. And I was like, you know what? This also hits home to me because in 2010, the day before my oldest son was to graduate from high school, we were heading home from his senior breakfast. I was going home to finish up some cakes and get ready for Landon's graduation party. My husband was driving. My youngest son, who was a sophomore at the time, was in the truck, and the elderly couple pulled out from a concrete truck. The concrete truck swerved over. Make a long story short, we hit a pole, and my husband was killed instantly the day before my oldest son was graduating. The impact knocked me silly, but it didn't knock me out. And when I did get composure and could see, I saw my youngest son hanging out over the top of the truck. It was bad. He was distorted, eyes open, bleeding. I thought he was dead. I could only see a part of my husband's arm. And I prayed to God to help me get out of that truck. God's real, God helps. To this day, they don't know how I got out of that truck, but I got out. And something said, don't touch Justin, because you can hurt him worse. To make a long story short, they called in 3 helicopters, and then I heard them call one off, and I knew Eric was gone then. They rushed us to Holston Valley. They took my son in. His kidneys were messed up, 2 punctured lungs, his spleen was gone. He ended up having to have like 400 stitches. He should have died. But because of God, and because of the people who were working that day, he's here today, and he's got one more check ride to be a pilot. Now, I said all that to say this. If he'd had to go farther, he probably wouldn't be here. But I was told, Shoni, you don't know what you're talking about. Kingsport's never been level 1. Never been level 1. You're deceived. I was told by a government official that it was always at the level it's at now, that we just didn't know it. And that they took care of my son and saved him at the level that it's at now. Said, why are you so upset? You need to understand that you got the same level of care then as what you're going to have now. Anyway, y'all, that's my Ballot Hill story. Because that's what the name of this place needs to be, Ballot Hill. I've got a heart for people, and I see a lot of stuff. We ain't seen bad yet, but it's coming. Make your voice heard. Don't straddle the fence, be on one side or be on the other. But we are in some serious, serious trouble. Oh, by the way, I have another meeting with Lindy on Monday.
Okay, so it is 9 o'clock, and yes, ma'am.
For Kelty, who got heard, how do people share their stories to ballot? Is there a website? Is there an office number? I mean, if somebody has a story like that to share, how can they share it with Ballot Help?
I have, I'm not shy. I emailed Lindy from the ER. I was on the phone, text, and I did use a golden parachute. That's called knowing somebody who knows somebody.
Yeah.
So, but we shouldn't have to know somebody to get wheeled up and get extra special care. So it's find out, Danny's got numbers, people have numbers, there are ways to.
Yeah, there is a, like, tell Lindy, like Lindy does have these cards and she does have an email place and you can submit online, and what I'll do is I will post that information. What I have seen most often is that the folks who don't know somebody who knows somebody have to raise hell on social media, and then you might be lucky if they think they can win you over and you'll get a meeting. If you don't, then you can still do it. And then I'm not saying don't share your stories with ballot, because you should. Absolutely you should. I also think you need to share those stories and experiences with CMS, the Centers for Medicare and Medicaid, with KEPRO, QIO, which is their quality improvement organization. Yep, it's on the second page of that newsletter, because those are the folks who do investigations along with the Joint Commission. This did run longer than intended, so we don't have a lot of time. It's 9 o'clock already. We have to be out by 9:30 and get everything down and kind of out the door. Does anybody have anything really important that we need to ask? Because here's what I'm going to say. I think that what we heard tonight from physicians and other specialists is that we need to have a say in our healthcare, which either needs to be a way for the public to determine members of the board, or for us to be able to establish a hospital authority. Those seem to be the things that are most prominent for us to be able to make a difference in our healthcare. So the first step in that is to hold public hearings about those things. So when you leave here, contact your local officials and have them put it on their agendas for their next county commissioner meetings, board of supervisor meetings, all of that. If you have additional questions for Dr. Berry, Dr. Olson, Dr. Smith, Kelty, Priscilla, who I'm so grateful that you were here, and I'm sorry that we didn't get a chance to do the panel, or even Commissioner Angie Stanley, you can email me at thedannycook, TheDanicook, at protonmail, PROTON, mail.com. It's a secure email address. Yes.
Also, I spent a lot of time, actually today, on the phone with a official with the Virginia Department of Health. If it is a Tennessee hospital that you had this experience with, you need to contact the Tennessee Department of Health. If it is a Virginia hospital, you need to contact the Virginia Department of Health.
So regardless of where you live, if the issue with the facility, if the facility is a Virginia facility, contact the Virginia Department of Health. If the facility is a Tennessee facility, contact the Tennessee Department of Health. Does anybody have any other questions that I can answer, or someone can answer really quickly? I hate that the question and answer session got shut down. Anything? Give it to me. Yes.
I just want to make one comment that was said earlier, and I just want to reemphasize that the things that is, I'm sorry.
Okay, yeah, you can go to this podium right here, Priscilla.
All right. Okay. All that I wanted to say is being an RN, the things that are going on in our hospitals. I still network with many of the RNs that are presently working, particularly at Holston Valley. The treatment that they are receiving is, I have a hard time even believing it. And I was a manager essentially for around 30 plus years at Holston Valley, and was a director of inpatient services. So I knew what the expectations were, and I knew what the expectations of leadership was too, and it was not to treat our employees terribly and to force them into overtime and to take away pay. We did everything that we possibly could to incentivize them to stay with us. We had all different kinds of programs. All of them have been taken away, and which means money has been taken away from the RNs too. So when you hear in the newspaper, it absolutely infuriates me when I read about, how we have a national nursing shortage. Yes, we do. But I'm telling you, here in our area, in our region, we have probably about 10 RN schools, and that's not even counting the LPNs or the certified nursing programs, that feed into our hospitals. So we have plenty of ability to be able to pull RNs in. But the problem is we can't keep them because of how they're being treated. And it breaks my heart when I hear of new RNs that are just now starting. I had one that goes to my church, but she's just started oncology and she's so excited. I have to fake my excitement for her. She's at Holston Valley.
because I know what she's going to end up in and how she's going to be disheartened. So when y'all read the newspaper about, they talk about at Ballot about, oh, how there's a national nursing shortage, and so that's the problem. No, it's not. The problem is how Ballot is treating employees, and it's just not nursing. It's all employees.
Absolutely.
And it makes, and it really is I don't believe anything that Ballot says in their articles, for one thing. But that is one area that just really breaks my heart, is how they talk about it. Because I'm telling you, and I want to defend the nurses that are still there, because they're outstanding.
Yes.
And it's not their fault when you're having to wait for things because a piece of equipment don't work. They're not being provided the things that they need. Their intention is to shut down Holston Valley or to make it essentially just a cavity of a hospital. And that's what they're doing. And we have got to, because as Danny said, we can't, 50 or 60 people cannot fight this issue. It has to be. Our whole community has got to start speaking up and quit sitting back on the fence. And I get tired of hearing people saying, well, why don't you do this? No, why don't you do it? We've all got to do it. We've all got to pitch in. It's the only way that we're going to be able to make any changes. And I'm tired of people really truly sitting on the fence. I'm just being honest. That's my
Okay, so Priscilla, I appreciate you. Like she said, she was a nursing manager for essentially 30 years. There's a lot of expertise that you've heard tonight about what's truly happening with our healthcare system. You know, you hear Ballot talk all the time about misinformation on social media. Well, this was direct information from healthcare professionals and experts. These are documented facts and figures and numbers and experiences and real people with real babies and real children and real grandbabies. And, you know, this is our chance to stop this from becoming the example that they implement in rural America everywhere. Folks, make no mistake, we are the test market for this COPA. We are the test market for passing laws that tie the hands of the federal government, that keep the FTC out of issues that shouldn't be, to create medical monopolies that do whatever they want to with healthcare and then make a research facility to go along with it when you combine it with a university. We're the test market. And I don't think that we deserve to be treated this way, and no one else in this country does either. This is our opportunity to make a difference, and make a difference now. Contact your local officials. Demand that they have public hearings, explore setting up a public hospital authority, and make Ballot be accountable for what actually needs to happen. We will do more of these if you guys will attend. We will absolutely 100% do these, and we will do these in Lee County, Wise County, Russell County, Greene County, Tazewell, Johnson County, Unicoi County. You tell us where to come, and we will bring people to help inform and to educate and to equip you with solutions so that we can figure out an answer to the changes that are happening in our healthcare environment. Yes?
I see people on Facebook, there's an elderly woman in my community right now that she is like, this is what you do. She's speaking on behalf to commissioners and wants to get Jason Cobble involved, wants to get commissioners in Greene County to listen to what's going on. I am a resident of Greene County. I live in Greenville. I'll try to keep it short, but right here is a whole stack of my medical bills dating back from December the 2nd of 2018 when I had a raging UTI and blood test done and had to wait from 4 a.m. until 6 a.m. the whole entire thing, a history of just like reproductive issues. Back in 2012, the physician that whole time said, one, I'm too understaffed, I can't get a female to do an exam on you. And I can't get an ultrasound taken down here to do an ultrasound. I'm sorry, but by the way, your pregnancy test came back and it's negative. I know you and your husband's trying to get pregnant. I can't help you. But here's you some antibiotics and here's you something so you don't get nausea. We can't do it here, but you can go to Walgreens and fill those out. So I said, okay. Follow up with your OBGYN and family practitioner. Thank God I have a family practitioner and OBGYN in the same doctor's office.
He said, look, if you need an emergency situation, we're open Monday through Sunday, 6 to 9 p.m. for urgent care. Do not go to Ballard, do not go to the ER. This is in Greene County at Summit Medical Group. And it's Dr. Nichols and Carla Nichols as my doctor. After that appointment with the follow-up, basically, these are all my doctor bills, like I said, from December the 2nd, 2018 to April the 19th of this year. February, roughly, I started getting these. Collections.
Yeah.
My husband called his insurance because I'm through his work. They had no idea. They hadn't been notified to take out the insurance, so therefore his work reimbursed us $150. That's all they could do. We're under the majority of this whole region of 25 a year, 25,000 a year, maybe lower than that. I don't know what my taxes was last year, but we live on $600 a week.
Yeah.
I could get a job as a CNA. No one I want to work for in Ballard.
So this is another thing. We'll talk more about collections and billings and some of the things that we need to do to make sure that you are actually getting bills that are valid, make sure that your insurance is being filed, because those are concerns that we're hearing a lot about. We have to get out of the room.
One more thing. I have 5 collections, different collection agencies, 5 appointments on my right.
Okay, we'll talk afterwards, okay? Thank you guys for coming. Please reach out, follow online, and we'll have another one of these, okay? Where we have more discussion.